started. If Carrie can start, it's already started. I knew that. She's right there ahead of us all the time. All right, so let's go around and introduce ourselves. This is the Friday session of the Joint Standing Committee on Health and Human Services. This will be one of our last, if not the last, committee meeting for this session. But I'm looking forward to seeing everybody up in Augusta. That'll be a welcome change. So we're going to hear what's come out of the work that our analysts have done for language review as the major agenda for today. So let's go around and introduce ourselves. We'll start with Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the beautiful coastal towns of Boothbay Harbor, Southport, Edgecombe, Westport Island.
Oh, we just lost your audio. Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Javner.
Good morning. I'm Representative Kathy Dabner. I represent House District 141, which is located in Penobscot and Washington County.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Thank you, Mr. Chair. Good morning. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton. I live in Auburn and represent Senate District 20, which in addition to Auburn includes Minot, Mechanic Falls, Poland, and New Gloucester. Our staff has enabled us to get this far, so we want to recognize Erin Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts with the Nonpartisan Office of Policy and Legal Analysis.
And Anna Broom.
Hi, I'm Anna Broom, and I'm the other legislative analyst, and I also work in the office of the Nonpartisan Office of Policy and Legal Analysis.
And Carrie Withy.
Good morning. My name is Carrie Withy. I'm the clerk for the Health and Human Services Committee. If you need any assistance this morning, you can email me at hhs@legislature.maine.gov.
And Carrie's been a big help in getting people into the meetings when the technology has gotten in the way. We'll probably do our best to check off technology problems during today's session. It's been a daily occurrence, so bear with us when that happens. And since this is language review, there'll be little opportunity, but occasionally some for comment from public attendees. So we'll make arrangements to invite them into the conversation if we need some help sorting out something that's related to language changes. So I'd like to start with Representative Perry. You have go ahead.
In terms of language review or?
No, in terms of the bill that you wanted to bring up.
Yes, LD 1001 I wanted to bring up. When I would like to ask for an ability to reconsider, have been voted on the majority side.
Would you like me to bring the language up?
Sure. Is there a second for that vote, for that ask for reconsideration?
Second.
Okay, thank you. So, and I was going to bring that up. Are there any discussion about the vote purely at this point for reconsideration?
Can you see that? This is
Yes,
1001.
we
So
can.
I just want to remind you of what the amendment was, because I know that you haven't, well, you've seen it perhaps in your email, but you hadn't all seen it yet. So my understanding of the amendment was to move it from the section that it was located. It was in 22, it's now in 34B because that's where the intellectual disability and autism folks are. And this is adding a subsection that comes immediately after medical care. But this is not exactly the same as that because that's a section about rights to medical care. And the reason that you did this is because there was no definitions in the original bill, but also it added in this language of the person who's unable to communicate with anyone other than a family member, or and that should say or guardian, I'm sorry, is entitled to access to support personnel. So this is actually flipped on its head. It was drafted originally as a parent's right to access to their child. And this is flipped on its head because of the way that that chapter is drafted. So I just wanted you to all see that. I know that you're going to reconsider, but there may be still some people that want this amendment. So I wanted to make sure that you saw it first.
Thank you for that. So any discussion about the move to reconsider? So yes, Representative Stover.
I just, Anna, if you could bring that up again, there was just a typo in.
There is a typo, I'm sorry.
Instead of or, it says of.
That's right. There is a typo. I mentioned that as I said it because I saw it as the same time as you did. It is a typo.
Thank you.
Did you have your hand up, Representative Perry?
Yes, I did. I just wanted to mention, I voted for what I thought of as amendment, not as restrictive as this and not using the law courts in terms of doing this. So I really am not happy with how this looks. So therefore, I want reconsideration.
Senator Moore?
Yes, I would. Anna, can you remind us what the initial vote was on this? I was thinking it was a divided report, but I wasn't sure.
It is a divided report, but Kerry will be able to tell you that.
Yes, give me just 1 minute to pull that up.
Sorry, Kerry. I only keep the vote of who's in the room, Senator Moore. That's why I can't answer that question.
No problem.
I do know that the during the actual committee meeting, the majority was all not to pass, but it flipped after everybody had voted. But Kerry will know exactly what the numbers were. Although I can tell you that Representative Perry did vote during the meeting, not afterwards.
So that's interesting. If Representative Perry was on the minority side after all the votes were counted, then it really takes somebody from the other side to introduce the motion to reconsider.
She is on the prevailing side because the vote flipped after everybody had voted.
Okay, thank you.
And you know, and sometimes we do actually bring that back so that you can vote it, so that you have a majority report like during the meeting. Mm-hmm. But we had held off on that because we had heard that there were some folks who might want to change their vote. So it seemed pointless to keep doing this around and around and around. It's too much work for Kerry.
What can you tell us, Kerry?
So the original motion was ought not to pass, and the vote on that was 6 yes, 7 no after the absentee votes came in, and that report was ought to pass as amended.
The final report was ought to pass as amended. Okay. All right. So Representative Perry was on the prevailing side. So it is authorized that she can ask for a reconsideration. Is there any further discussion about that? Does that answer your question, Senator Moore?
Yes, it does. Thank you.
Good. I don't see any questions. So let's make this official and ask Kerry to record the vote to reconsider.
Representative Zager. Representative Zager is absent. Representative Malorano. Representative Malorano is absent. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin. Representative Griffin is absent. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan.
Yes.
Representative Madigan. Yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 8 yes, 5 absent.
Okay, so the motion to reconsider carries. Representative Perry.
I would like to move ought not to pass for LD 1001.
I second
Second.
that.
Any discussions at this point? Yes, Representative Javner.
Thank you, Senator Claxton. If Representative Perry would not mind, could she just once again explain the change that she is wanting to see happen for this?
Sure.
Yes. When I looked at the amendment, it is much more restrictive than I expected and a bit broader. And the fact that you have to go to court to make any changes just made it much too cumbersome to even look at or use. So I really don't think this is something I want to work with.
Does that answer your question, Representative Javner?
It does answer my question. I think that now I'm going to have to go back. I'm going to need to really review that, the amendment before I'm ready to vote. So.
Mhm. And just to be clear, that amendment that you referred to, Anna, is that a proposed amendment or is that the one that we voted ought to pass it?
I mean, I only drafted it yesterday.
Right. So that particular amendment would be to move a portion of the bill that we did pass into a different section.
Right, and I had understood that that was what was agreed to, but I had also understood from Representative Lemlin, who was the sponsor, that he would restrict it to those who couldn't communicate with their family or guardians, because that seemed to be the issue.
Okay, so the vote to reconsider does not include the amendment right now. So can you show us the bill that we have voted ought to pass as amended? Just so we're clear about that. And then I'll go to Senator Moore. So this involves, this is what we've passed, and it involves section 22 and an emergency clause.
I didn't take the emergency clause off.
Right.
And this is titled, this is the original bill. This is the bill. This is not what you voted. I mean, you voted to amend it, but this was the original bill.
Okay, this is the original bill. Okay. And then the amended version, do you have that we approved?
Oh, sorry. Yep, try that again. If you remember that one of the issues at the beginning was that the bill was drafted as special needs, and that was not defined. And one of the decisions to move it was to take advantage of the fact that in 34B, which is the title that deals with ID and autism, that there are definitions for that. So it doesn't require new definitions of something that we don't have a definition for. So that's the reason why you moved it. Title 22, Section 20A, I believe, is just in the general section of Title 22, which is DHHS.
So this is the vote, this is the amended version that we voted to pass.
Yes, but it's the first time you've seen it was yesterday.
Right. Right.
And
And
I did send it to the leads and the sponsor yesterday as well, although I didn't actually hear anything. That is not a criticism, by the way. Emails were flying everywhere yesterday, but I did send this separately and earlier to the leads and the sponsor.
so Senator Moore.
Yes, I just, and thank you for bringing up both of those, Anna, because that is, I was confused too as to what we had approved. So the reference to the court of law is just saying unless the parents or guardian's access has been limited by a court of law.
And that's the language that was in the original bill. I just carried it over.
Exactly,
Correct.
exactly. So really the only thing that has been left out of this amendment was the last sentence in the original bill.
Yes, and the reason I did that is because it does say, but not limited to family members or guardians. That's the reason why the including but not limited to language is there. Because it is flipped on its head in a sense, because it does say that the person with the intellectual disability or autism is entitled to access. So it begins with the person who is in the hospital. It doesn't begin with the parent.
I gotcha.
So it's patient rights, not parents' rights necessarily.
Right, and that's because it is in 34B. It also was one of the criticisms of Disability Rights Maine, but that's not the reason that I did it that way. I did it this way because this is how the rest of this title is drafted, but it was also one of the criticisms. And I'm certainly not going to speak for Representative Lemlin, but he's talking about people who want their family member there.
Right, because of not being able to communicate. And that was the example, that his constituent brought up with a child that had autism and was unable to speak to anyone but the parent, or could not speak to anyone but the parent.
Right.
So I think this, in my opinion, I think this is capturing what we were trying to do.
Well, I'm glad to hear that, Senator Moore, because I was getting a little scared there.
Representative Meyer.
Thank you, Mr. Chair. The bill is still allowing in-person participation by a parent or guardian, not limited by a court order, in person, despite the circumstances around a state of emergency going forward.
Yes.
Which would continue to put our hospitals and nursing homes in the unfortunate situation where they would need to choose between federal and state laws or guidelines in a state of emergency that is, at this point, prospective in nature. We wouldn't know the details of the next state of emergency. But this would allow for in-person presentation at one of Maine's hospitals or nursing homes, regardless.
That's the important word, the regardless. Yeah, okay. Any other comments or questions? Representative Javner, are we closer to answering your questions?
Yes, thank you, Senator Coxon. I do appreciate that very, very much. I do still think, though, that it's going to be important for those patients, that are nonverbal, to be able to have an advocate there for them, no matter the situation. So I do think it's very important that we allow that for those patients in particular. So thank you. Thank you, everybody. I appreciate it. Thank you.
Would it be helpful to hear from a couple of the hospital systems about how they feel about this? Are folks inclined that way or no? Okay. And any other conversations about this? Personally, I was impressed that the Disability Rights of Maine felt that the legislation was unnecessary because those rights were already guaranteed. And may not have been provided in such a manner as would be ideal in the midst of the early portions of the pandemic, but we didn't hear other testimony about similar episodes later on in the cycle. Those are the things that impressed me. Any other questions, discussions? Then there's a motion on the floor, ought not to pass. Yes, Representative Javner, did you? Okay. There's a motion on the floor, ought not to pass. It's been seconded. So I'll ask Carrie to collect the vote.
Representative Zager. Representative Zager is absent. Representative Melarano. Representative Melarano is absent. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin. Representative Griffin is absent. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan.
Yes.
Representative Madigan. Yes. Representative Javner.
No.
Representative Javner. No. Senator Moore.
No.
Senator Moore. No. Representative Meyer.
Yes.
Representative Meyer. Yes. Senator Claxton.
Yes.
Senator Claxton. Yes. That's 6 yes, 2 no, 5 absent.
Thank you.
I'm sorry, is the minority report, the amendment, is that okay with you all? Okay, thank you.
And I should explain to folks that that's a higher than usual average number of people who are absent, but folks are trying to be in multiple different committees or hold down jobs. That's why they're not here today. They'll have a chance to vote in the next 24 hours or by noon on Monday on this too. But that's why people are absent.
It's actually Tuesday, I believe, because Monday is a holiday.
Oh, that's right. Thank you. Thank you. So Representative Perry is off to a vet appointment for her puppy.
For my cat.
Cat. Oh, okay. All right. All right. The other was Margaret. Did you have a motion?
Yes, thank you, Mr. Chair. I would respectfully ask for reconsideration on LD 1695.
Is there a second to that?
I would second that.
Okay.
Okay, so this moved and seconded. Any further discussion of the reconsideration portion?
Well, I can explain why I'm asking for reconsideration in that I have heard from my municipality and they are very, very worried about this bill and that they can't bear the cost of it. And I voted in favor of the bill when I was probably not paying enough attention, but thought that this cost was going to be shared by the state. Now would like, and that's the reason that I'm asking for the reconsideration.
Senator Moore.
Again, Carrie, would you also be able to let us know what the initial vote was on this one as well?
Yes, I'll be back in 1 moment.
Thank you.
Would you like to see the amendment in the meantime? Does anybody need that? Okay.
Sure.
I'm going to bring up the bill first, if I can manage to do that correctly. So this is the general assistance bill. And what you're looking at here is section 2 and 3. I'm sorry, I might be able to make it bigger for you. I see you all peering at it. So section 2 is the section that if the maximum level of assistance has been exceeded by the housing costs, then the person remains eligible for other basic necessities. And then the next section, section 3, this is the section that It relates to presumptive eligibility. Right now, under current law, if somebody presents at a homeless shelter, they are presumed to be eligible for general assistance. This would change that so that a person who is experiencing or facing homelessness would also be presumed eligible. In other words, they wouldn't have to present at a shelter. And the idea behind this is that you wouldn't need to go to a different municipality. So that was the purpose of that. So these two sections of the original law, I can show you the amendment, although there's not much to see, is the only two sections that are left. I am, however, as soon as I see Senator Moore look away, which means I know she's finished reading, I will go to the amendment only because, okay, the amendment doesn't have a great deal, but the fiscal note is attached to that. So I have to keep moving you all around, which is kind of distracting. So you can see here, it removes all of the sections except 2 and 3. And then the fiscal notes are very difficult to actually price for general assistance. So it basically says that it will potentially increase assistance, and a more precise estimate of the fiscal impact is not possible. You did receive a lot of information yesterday, including from the sponsor, from the department, and also some information from Eric Jorgensen about the rental assistance, because that seems to be part of the issue here. I'm certainly not going to go into it in detail because it's not what I know, but I think one of the issues that the sponsor had was that there is a lot of rental assistance coming through Maine State Housing Authority from the federal government, and it isn't clear exactly how those populations, I don't know what the Venn diagram looks like, is how I like to think of it. But you also did receive some information from Molly about the maximums in various parts of the state. I know she's here if you want more questions about that, if you have more questions about that. I know I looked at it because it was interesting, but it's up to you how you want to go. But the point that of the information that Molly has sent is just to back up that there will be a cost, but they can't always say how much it is because they don't know, and it is a shared cost, as Representative Craven mentioned. And there were some other pieces of this bill originally that did require more funding coming from the state, but those sections were all removed, and so you are left with the 70-30 split.
So does that answer your question, Senator Moore? Chance to look at the original and the amended version?
Well, my question was more on what was the initial vote.
Right, and
Yeah.
I see Carrie's back for that.
Carrie's ready.
Right.
The original motion was ought to pass as amended, and the vote was 8 yes, 5 no, and the minority report was ought not to pass.
Okay.
Thanks, Carrie.
All right. So the motion on the floor right now is to reconsider LD 1695. It's been moved and seconded. Any additional questions or conversation about that? Then we'll ask Carrie to poll the members.
Representative Zager. Representative Zager is absent. Representative Malorano. Representative Malorano is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry. Representative Perry is absent. Representative Griffin. Representative Griffin is absent. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 6 absent.
Okay, so the motion to reconsider carries. And I'll go back to Representative Craven.
I would move up not to pass.
Is there a second for that?
I'll second that.
Thank you. And discussion about this ought not to pass motion? I'm not seeing any. We ready to vote? All right, Gary, your turn again.
Representative Zager. Representative Zager is absent. Representative Malorano. Representative Malorano is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry. Representative Perry is absent. Representative Griffin. Representative Griffin is absent. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 6 absent.
Thank you very much.
Thank you, Representative Craven. I have to say that some of the other legislation that looks more directly at the lack of affordable housing in the state really is the major next step in terms of addressing the issues that are associated with general assistance and renovating or re-examining how to do that as best we can. Okay, so unless there's another bill that somebody wants to bring up, we can move to reconsiderations. So I will defer to Anna and Aaron in the order in which you want to run through the short list of language review.
Okay, so we're going to take turns because we can only bring up so many on our screen at a time. So
Okay.
I'm going to do about 3 more and then I'm going to turn it over to Aaron. Is that okay with you, Aaron? Okay. So I have a tricky one to begin with. I need a little direction. So that's part of the reason that I'm going to bring this one up first. This is LD 964. This is another general assistance bill. This is Representative Fecto's bill about recovery. So this was can't swear on the Zoom. This was a pain to draft. So it's not difficult at the beginning. So this is actually, it's not a strike and replace. It's partly a strike and replace, but it's just so that you can see what's going on here. So this is one of the things that you did was made the requirement for recovery residences to receive general assistance or any kind of housing assistance. You put it off until July 1st, 2022. This was a unanimous report, by the way, just cutting off Senator Moore at the pass there. At least I believe it was. So you had this from July 1st. So first of all, this is in Title V. This is the section that has the SUD section. So this is a whole new subchapter, but this is just a little piece. And so it requires recovery residences to be certified from July 1st, 2022. I don't know that there are any contracts, but you know, that was just in case. To the extent not in conflict with federal law was a request from Maine Housing that you all agreed to, and he presented I also believe the sponsor presented that, and that was because there is some projects out there right now. So that's the straightforward part. And then we get to the general assistance part. We have to include a definition. So we did that, and that's not the issue. So here's where it gets tricky. So you had a number of things. Now, the problem with drafting general assistance is you kind of do you can't have this unless that happens, except for this. So that's what we have to draft, and that's why it's tricky. So I wanted to show you what I did to see if this is indeed what you would like. So first of all, the July 1st, 2022 requirement also applies to general assistance. So you put that off for a year. You kept the piece about not denying general assistance to a person for the sole reason that the person is in a recovery residence. So I also moved this from the section that it was in general assistance. It was in the section with the ordinance. It's now in the section with eligibility, and that there's no perfect answer to that. But So it said, so the first section is the same, it's just put in a different place. And then it says from July 1st, 2022, a municipality may not provide housing assistance to a person residing in a recovery residence that has not been certified. So that's straightforward. Here's where it gets tricky. So then you have this language that you put in at the very last second, just before you voted, that said, well, what if that person is in a recovery residence that's not certified? Then they would get no assistance, and any bed is better than no bed, right? So then you said, well, they should have 30 days, and the municipality would have to let them know that you're currently in a recovery residence that's not certified. So next month, when you come back, you need to be in a certified residence. The problem is that general assistance is you're eligible for 30 days at a time. You have to constantly go back and reapply. That's, kind of the way that program works. So I wrote this as best I could. I said that except that a person may receive housing assistance while residing in an uncertified recovery residence for one 30-day period only, and the overseer shall inform the person of the requirements of this subsection. So if that's okay with you, then that's what I'm going to do. And then the last part you had in the original bill, which is if you are ineligible for housing assistance because you're in an uncertified recovery residence, you remain eligible to receive general assistance for other basic necessities. So that part was the same as the original. I think that's, we'll come back to that last bit in a minute. So that's the tricky part, is the 30-day thing. So I just wanted to make sure that that is what you were anticipating when you voted it, because it's kind of tricky to say you have to be in a certified residence, but if you are in an uncertified residence, then that's okay. But then next month you have to be in a certified residence. It just means that the municipality is going to have to keep track of all of that. And I didn't know if one 30-day period only is what you were looking for, because that, people might, I don't know the answer to this question exactly, but I assume that some people go on and off general assistance. You need it 1 month and then maybe a year later you come back again. I don't know. Obviously, you also hope that, people aren't in recovery residences for really long periods of time either. But I just wanted to make sure that that is what you were expecting. And then the last part, I believe, is what you were expecting, which was, this is the issue about the recovery residences having to open up their books to general assistance and show them why their costs are greater. So you had a long conversation about that, and you ultimately decided that the department would go ahead and amend its rules to figure out how to take into account what that would look like in terms of assistance. So that was the rulemaking requirement. I believe your intent was to have it in place by the time that July 1st, 2022 came into effect, because somebody specifically said, well, I'll have a year to do it. So I believe that's correct. So I wanted to make sure that all of that is what you were anticipating, because it really was tricky to write, because you are saying you can't have assistance unless you're here, unless that happens. So that it ends up in one great long sentence, which is fine as long as it's what you expect.
Thank you, Anna. Crafting those things sounds like a challenge. Are there any questions about what's
I
just
didn't
been laid
throw
out?
things though.
Well, that's an upgrade.
That's correct.
I did recommend she get a Nerf ball a while ago, as opposed to something hard that might maim somebody. Are there any comments, questions, concerns about that language? Does that accomplish what we had intended? I don't see anybody with a hand up, so we'll assume,
Okay.
which is always a bad idea, but we'll go with the fact that that's accomplished what we wanted. So thank you for that.
Okay, so the next one that I'm going to do is, hopefully you can see 1573. Can you see essential support worker reimbursement on your screen?
Not yet.
Oh, blasted. Okay, hang on.
Do we need to put in a tape delay for your commenting on these bills, Anna, so we can go?
No, I just realized I forgot to hit the share screen. That was the problem there. That was operator error rather. Now can you see it?
Yes.
Okay, so this is, obviously one of the things that you're going to be interested in this bill is a fiscal note. And I don't have that yet because it was only drafted at the beginning of the week. And I know it's difficult for both the department and Luke to do it. So I'm going, this is LD 1573. This is Representative Fay's bill. That you also pulled in the rates. So I'm going to skip down a bit to the markup piece to show you, it has an emergency preamble on it. So we'll go past that. This is changing the language from direct care worker to essential support worker. And then we kept these definitions largely as they were, although I'm really glad that Representative Madigan is here today too, so I can make sure that this meets her needs as well. Well, not her personal needs, but so you're changing this essential care, essential support worker in each place from where it said direct care. I also made a change to subsection 4, which is the in-home and community support services, and this is where I'm hoping that Representative Madigan will let me know if this is not right. She's already got a hand up, so that's a bad sign. So I've included in here in-home and community support services means health and social services, including behavioural health and other assistance required to enable adults with long-term care needs to remain in their places of residence or group homes. These services include, but are not limited to, self-directed home health, personal care, blah, blah. And then I added in daily living support, behavioural health, professional services. So before I go on, I want to make sure, because I can see that she's got her hand up, that part is correct.
Representative Madigan?
Thank you. I know this is the part where you're defining what they are, but I just want to make sure that this would include those folks receiving daily living supports under Section 17 in behavioral health.
Right. So as you say, this is just the definition section. So when we get down, I can show you that it's specifically included, but that was why I put daily living support services here. And I also put behavioral health professional services. Is that also necessary in there?
Yes, because some of that will be under Section 65.
Okay.
Senator Moore?
Yeah.
I guess I'm pausing for just a second because I thought we had some discussion about the essential support worker. And I think Paul Sarcier was not comfortable with that because of the essential part of it.
Right. So I did follow up on that actually. So when you voted for that. You were voted for essential support worker, I believe, to distinguish it from whatever the other term that we're using right now, which has essential in it, and I can't. It's fallen out of my brain. But I did actually follow up with Representative Fay and with Jess Mara, who I believe is also here, to see if they were willing to use a different term, or how wedded they are to the term essential support worker as opposed to direct support worker. And I was told that they would prefer that term. So obviously it is your bill at this point, but I did follow up on that for that reason.
Thank you. I just wanted to double check on that. That was one thing.
And yes, we did have that conversation and I played around with different words, but the way it was written was the way folks wanted it. Yes, Representative Meyer.
Thank you, Mr. Chair. Just going back to essential support, direct care, and that conversation. Refresh my memory on what Director Saucier had indicated was his preference.
Direct support worker.
Direct support worker. And what you're saying, Anna, is that Jess Mauer and the bill's sponsor were not in favor of that?
Right. They would like to stick with essential support worker.
What is it in statute?
Direct care worker.
And we're not staying with direct care worker because
I think that was partly a function of adding the mental health side. I think that was part of it, but I think it was more of a communication perhaps type issue. So I don't feel that I'm the right person to speak to that.
Okay.
Do you want to hear from somebody else, Representative Meyer, or it's?
I guess I'd like to hear from Molly or Director Saucier on that. And also from Jess Mauer.
Okay, so I'll ask Carrie to bring those folks in. Senator Moore, did you have your hand up?
And
I
will
did,
go-
and I guess I was just wanting to make sure that we had the definition of essential support worker. If we were including that, since that's not in statute already.
It's in the bill, so that's the markup version.
Okay.
And that was just because I was too lazy to like type it all out again. Actually, it's not really that I'm too lazy. It's easier for the revisor's office. But and I'll go through the rest of the amendment shortly. But
I do see it in the definitions now, and I apologize.
no, that's all right. There's a lot going on here, Senator Moore. Believe me, we're having trouble keeping up.
Right, thank you.
I see we've been joined by Representative Griffin. Would you care to introduce yourself?
Sure. Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Keduskake.
Thank you. And I see Carrie has her hand up.
Thank you, Senator Claxton. I'm so sorry, I was just on the phone. Could you repeat who you would like to have brought into the room?
Sure. If we could bring in, I think I saw Molly Bogart's name there and Jess Mauer. Who else, Representative Meyer?
I think that's it, just to hear both sides of this, refresh my memory.
Trying to come up with the right term.
Yep.
Good morning, Molly Bogart.
Good morning.
You want to just introduce yourself as long as you found that button?
Sure. I'm Molly Bogart, Director of Government Relations for the Department of Health and Human Services.
Okay. Any thoughts from the department or in your role as PR for Director Saucier?
Sure, I will channel my best, Director Saucier. I think our concern with essential support worker is, or essential care worker is both that it is not well defined elsewhere in statute, and so the clarity around who that includes is not there, and also just discomfort with the term. When someone is essential, it means that others are not essential, and we think folks across the spectrum of work in these fields are essential, and delineating some as such and others as not is a concern for us.
Thank you. And we're also joined by Jess Mauer. Welcome. Good morning.
Good morning. Thank you. I'm Jess Mauer. I'm the Executive Director of the Maine Council on Aging, and I'm pleased to be here this morning. Thank you for giving us the opportunity. Just want to say that we do have an unprecedented alliance of folks working on this bill, including all of the behavioral health professionals, the home care, long-term care, including the Maine Healthcare Association, Leading Age Maine and New Hampshire, the Home Care and Hospice Alliance of Maine. And we did briefly poll these folks this morning, and we agreed that essential support worker is more accurate. And I am fully, I guess, to answer the first concern that Molly raised, is we can do a better job of defining these folks in statute. That's just a drafting issue. The other piece is the work that these folks do is literally life-saving. And I think we can agree that that's essential. This is activities, basic activities of living, toileting, eating, walking, getting support for our behavioral health challenges on a day-to-day basis is essential. And the fact that we, I guess, even have to have this conversation is in light of what's just happened during the pandemic, which is over and over and over again, the confusion about healthcare workers and their essentialness as opposed to home support workers and their lack of essentialness, and the confusion within the department. When Director Shaw spoke to us numerous times, asked a question about vaccinations, and home care workers, he said, yes, they've been prioritized. And then when we asked again, no, we're talking about, personal support specialists. No, they haven't been prioritized. And so we feel like it's really an important time because of COVID, because of the impact COVID has had on all of these populations we're talking about, that we clarify that these workers are in fact frontline essential support workers, and feel really strongly about that. So thank you.
Thank you for that explanation. Does that answer some questions for the committee? Any further comments? So to go back to the drafted version, it sounds like people are anybody want to change the name? I don't see any hands up, so it looks like there's some impetus to stay with essential if it's well defined. Essential support worker if it's well defined.
So if it's okay with you, I'm going to carry on and go through the rest of the amendment. Okay.
Mhm.
So that's why you see the markup there. It goes in this chapter 1627. And then you see the starting January 1st, 2022, which I believe was the date from the original bill, services for essential support workers that are reimbursed by the department under main care or state funded programs, because originally this was drafted to apply to everybody, which would have included the private sector and everything. Must include the 125% of the minimum wage, and that's an amount, and this is a draft, by the way. It has come back from the reviser's office, but I haven't, I think it's come back. No, it hasn't come back from the reviser's office yet. They may have some changes, but 125% of the minimum wage as defined in the law for the labor portion of the reimbursement rate. And then the increases take place in the same way that they take place for the minimum wage. So it's just tied to that section. As the minimum wage goes up, so does this. And then the piece that goes along with that you mentioned was just the provider side of that, the taxes and the benefits. So it's just literally the piece that is directly related to the reimbursed wage increase. So we're not talking about health insurance or any of those things. We're just literally talking about payroll taxes. One of the very few times that I managed to stump Luke, and I had to get somebody else to answer that question for me. Anyway, and that just goes along with it. And then you had the rebasing, which, and one of the things that the department is saying is that they are planning on rebasing every 5 years, under their new plan. So ultimately you may not need this, but you wanted that in there. So it is in there. It won't obviously do any harm. So the rebasing every 5 years. I didn't have to put in the annual COLA actually, because this by definition includes an annual COLA. So every time the COLA goes up, the minimum wage goes up, the 125% goes up. So I realized that you did actually specifically include that in your amendment, but once I went to draft it, I realized that it wasn't necessary and I was actually just confusing the issue. But the rebasing is different. So that's your every 5 year rebasing. And then just the rulemaking language. So here is the question I believe that Representative Madigan asked me earlier. So this is unallocated language to specify what this section applies to. So that's to tie the definition to the actual sections of main care and state-funded programs. So these first you see the state-funded programs, and these were pulled, if you remember, directly out of the other two bills that you rolled in. The numbers are escaping me right now, maybe 878 and 283, something like that. So these are the main care sections and this includes section 17, which is the part that Representative Madigan specifically referred to, and then 65. All the rest of those are the ones that were included in the bill from last year and the other bill. So that's all of those sections in main care that specifically include what we used to think of as direct care workers, and we're now calling essential support workers. And then you get to the state-funded program, I believe this is. So these are the state-funded equivalents. So you can see there, this is consumer-directed, adult day. Section 63, you're quite familiar with. That's the state-funded one that's similar to 19. 68 is respite. and then 69 is the homemaker program. And these were all specifically included in those bills before as well. So that was very easy for me to include. And then you have to break these out separately because long-term care facilities, residential, are paid differently. So that's also pulled out of the bills that you had before. And then you asked, this is what you did instead of the oversight committee. You agreed to have a annual report for 5 years. The reason it's 5 years is because that's how long the oversight committee was supposed to last. This is a lot easier to draft actually than the oversight committee, I have to say. Jess, I know you don't like that, but that's okay. So then the department would provide an annual report each year on the department's efforts and progress in implementing the recommendations of the long-term care workforce study. It includes the data on unmet need, which you had specifically talked about. It wasn't in the original, well, actually it was in the original language of the oversight. There was language in there about unmet need that is different from the recommendations of the commission, but that was specifically in the oversight committee, and I did run that by the department to make sure that they knew that was there and that was not a surprise. And then the department must include in its reports the efforts of the department to include stakeholders, because the reason it doesn't have a stakeholder group is because, if you remember, Paul Saucier said that there are a number of different stakeholder groups that are involved in this. You know, there's the piece that Bill Monteo is involved in around qualifications and, you know, collapsing the alphabet soup for the word has escaped me, but training. And then, you know, there are other stakeholder groups doing different things. So that's why it, but it does require the department to include in its reports how they've included stakeholders. And then you also wanted the ability to report out a bill. That doesn't need specifically to be put in there, but it's always clearer. And the reason it's quite useful to have legislation in something like this is because this is the kind of report that has many different pieces, and being stuck with one bill is a pain. So that's as I said, it's not ideal that we don't have a fiscal note here, but I did only send it over at the beginning of the week. And so, you know it's going to have a fiscal note, and you know it's going to have a big fiscal note. And as soon as we get that, it will be emailed to you, and you will have a chance to look at it and say, oh, I don't like that. But as a committee, you may not have that ability. But as soon as I get a fiscal note, I'll let you know. But that's what I have on that. So I need to know if there's anything that you need to change or if that's okay.
Everybody okay with 1573, the way that's been laid out? Thank you for all that work, Anna. I see we've been joined by Senator Baldacci.
Good morning, Mr. Chairman. I'm Joe Baldacci. I represent State Senate District 9, which is the city of Bangor and the town of Herman. Thanks.
So thank you to Molly and Jess Maurer for helping us work our way through that. You have another one for us, Anna? Oops.
I'm going to do some easier ones now. So that'll be nice, right? Okay, so this is one that is complete, which is always nice. This is Representative McCrate's bill on behavioral shortages in hospitals. And what you eventually agreed to was amending, and you've actually seen this language. This comes as no surprise because you had it at whatever the last work session was. This is the one in which we worked with Dr. Landry to change the current reporting requirements and make them so they work for you and for them, and then include in these pieces here about the number of children served by crisis workers and the number of children who have waited for the appropriate level of behavioral health treatment in an emergency room in the preceding year. The department, and then there's this issue of the department making a reasonable effort to obtain information from providers, because there is this issue of it not being standard right now. And then the confidentiality, so that is of no surprise. And then you also saw this, I believe, at the work session as well, that the department will be working with hospitals to develop a consistent and reliable system of data definitions and data collection. You did have a somewhat long conversation in the committee about the 48 hours. I know there were some people, actually not so much on the committee, but outside of the committee, who weren't happy with the 48 hours, but this is apparently how that data has been tracked. So it's that's why you agreed to it. And then, so you've seen all of that language, and then you have the minor cost increase, which means that it does not go to the table. So that's the part you didn't have yet, and you hadn't seen the final version, what we call the ROSD version. So if that is good with you, I can minimize again. I can stop sharing if you'd like, or I can move on to the next one unless there are questions.
I don't see any hands up. This is your opportunity.
So hopefully you can. Did I move to 1528? Did that work?
You did.
Okay, so this is a nice big fiscal note. And I did have this yesterday, so this is not a new fiscal note to you. This is the one that increases the RN, LPN, and also independent rates. And then the department also, you also asked for an annual CPI for this. So that is included there. And then this is the looper thing that I couldn't explain if my life depended on it, but you didn't change it, so that was nice. And then so the original bill was 39%. You will move to 25% plus a CPI. The looper didn't change. And then this is the fiscal note that goes along with that. It's, you know, a significant fiscal note, 17 million total. General fund of 9 million when you get the full cost. So that's a big fiscal note that will go to the table. There's your total. So unless anybody has anything to say for that one, I can move on. And that one you did receive the fiscal note ahead of this morning. Okay. So Erin, I'm giving you a heads up. This is my last one for the moment. This is LD 17. This is Senator Maxman's bill about the transportation study. It has an emergency preamble. This is the one that you added a study to ahead of time, or a contract. I don't know what the right word is. So this is the one that would be section 19. It's a pilot program, $2,000 a total, I believe, in 18 months. And then it lays out the process that the department will identify the goals, and you did all of these dates during the work session. So the department said they could have the goals by October. By January, they would be able to contract with a vendor that would design the pilot project. That was the piece that you significantly that you added that was significantly different from the original bill. The vendor must include, I believe this was your language, Senator Claxton, methods of quantitative analysis and evaluation to measure improvements in the social determinants of health. And that was to, I believe, try to put some meat on the bones of that was a little bit different from Representative Zager, who wanted a control group. And then the contract with the vendor is expected to include the final evaluation. Obviously, we don't know whether that would, you know, it's possible that the people could not be there, but the idea is that they would design it, and then you had always expected that the evaluation would be done by outside, not within the department. And then the written notice, that language is the same as before, just that we had to change the dates. And then no later than the end of 2024 is when the 18 months would be up, and then you have the evaluation by the vendor. I did put in this another vendor if that vendor is no longer available, just in case that something should happen. And then you get a report the following year with the ability to report out legislation. Oh, and the report would also include whether the model could be applied to other populations, since I believe that that was part of the logic of that. And we do actually have a fiscal note for that now. I sent that out this morning. I didn't have it last night, so yay for the reviser's office. So I mean the fiscal office. So this is the cost of the contract, I guess, to develop the pilot project. So that also includes the pilot project itself, I believe. So if that's all good with you, I can shut up for a minute and load up the next round.
Very
Is that
good.
all good? Okay.
Thank you.
So I'm ready to go ahead, but it looks like Representative Griffin has her hand up.
Yes, Representative Griffin.
Is this an okay time? I understand you did some reconsideration votes. Is it okay time to do that? Or would you rather me wait?
No, that's fine. We can do that now. Carrie, are you available for registering Representative Griffin's votes on 1001 and 1695?
Yes, I can take those.
So 1001 was ought not to pass. Was the motion on the floor?
1001 was ought not to pass. Okay, that's a no.
Okay. And the other one on 1695 was ought not to pass.
And that's a yes.
Thank you. So I think you're
Thank you.
all current, and I don't anticipate doing much more voting today. So, all right, thank you, Carrie. So now we'll go to Aaron.
Okay, I'm going to share my screen for a while. I'm going to start with LD 819 because there's some questions that I think the committee needs to figure out on this one. It's about testing for radon. And the committee voted on the sponsor's amendment to replace the bill with the mandatory testing requirements to create what was called the main gold standard for radon testing and mitigation initiative. And so in order to accomplish that, I changed the title from one that requires testing for mitigation to one that creates a voluntary radon testing and mitigation program for landlords, homeowners, and builders. So this is in the Radon Registration Act. It establishes the main gold standard for radon testing and mitigation initiative within the DHHS to reward, recognize, promote, and assist landlords, homeowners, and builders who participate in the initiative. And a person who meets the criteria that's established in statute and by the department and rules may achieve this gold standard designation. For landlords, the proposal was, excuse me, two parts. One was that every 2 years, the landlord would conduct radon testing in compliance. I'm sorry, my allergies are making my voice screwy. Excuse me, in compliance with this chapter and any standards established by the US EPA. The results of the test would be submitted to the department, and the department would post the results on its publicly available website. The department would then pay for all costs for radon testing that occurs in accordance with this, with that testing requirement. The second part that would be required of landlords in order to obtain the gold standard designation is that if the results of the radon test exceed a level of 4.0 picocuries per liter of air or above, that within 6 months, the landlord would be required to mitigate that level to be lower than that amount. That the mitigation service would be provided by a person registered with the department under that chapter. And that after mitigation, the landlord would provide notice to the tenants that the radon levels have been mitigated. The department would pay for the first $600 in mitigation expenses on behalf of the landlord. And as a result of that test, if it exceeded the amount of the 4 picocuries. The second piece of this is the criteria for homeowners, that in order for a homeowner to obtain the gold standard designation, that a homeowner must, before conveying any residential real property in accordance with the real property conveyance chapter, test for the presence of radon, arsenic, and uranium. And then it defines residential real property consistent with that chapter. And this is similar to a proposal that you saw in Representative Kessler's bill, but it makes it voluntary to obtain that gold standard designation. The final piece of this is in relation to home builders. Home builders constructing a new home in a municipality that has less than 4,000 residents would be required in order to obtain that gold standard. The radon standards established by the US EPA, and that the home would be inspected. The department's directed to adopt rules to implement this section, and in doing so is directed to convene a stakeholder group. So I want to flag a couple of things. One is that when I drafted this yesterday, I forgot to add the proposed start date of this program of July 1, 2022. So that's on my radar and I will add that in. The second question I had to do with the criteria for homeowners. There had been feedback received on Representative Kessler's bill about clarifying whether the testing for radon, arsenic, and uranium would include air, or at least for radon, air and water. Arsenic and uranium would obviously just be in the water. So I'm looking to see if you want to clarify that the testing for radon would be in both air and water. But the biggest, I think, decision point for the committee this morning is about the criteria for home builders. So under the building code section of statute, which I'm going to pull up so that we all are looking at the same thing. A municipality of over 4,000 residents is required to adopt the Maine Uniform Building and Energy Code. Under the statute at 1A, if a municipality is smaller than 4,000 residents, although it's not required to enforce the Maine Uniform Building and Energy Code, but it's also restricted in that if it decides to adopt or enforce a building code, it has to be the Maine Uniform Building and Energy Code. And so even though towns of a smaller size aren't required to adopt that building code, if they do have one, it's going to be that code. And the reason this is important is because under, and I'm just going to pull that up again, under the amendment, it directs compliance with standards established by the US EPA relating to radon preventive features. My understanding is that the Maine Uniform Building and Energy Building Code has a different radon standard. And so this presents a conflict for municipalities, no matter what status they are, whether they've adopted the building code or not. In order to enforce it, they would be using a different radon prevention standard. So I think that there's, and also these inspections, these home inspectors are only authorized to inspect pursuant to that Maine building code standard. So I think that there is a way to fix this, but there's a conflict as currently presented. And I see Senator Baldacci has his hand up.
Yes, Senator Baldacci.
Thank you, Mr. Chairman. Thank you, Aaron. I appreciate very much your work on this. Just want to say, in terms of the, well, one of the issues I had was the incentives I had for the landlords. I thought was going to, I was going to have those incentives available also for the other two, the other two sections in that bill, so that
what would be available? I'm sorry, I didn't hear you.
Yeah, so the incentives that are listed there for landlords to participate, I was going to include those similar incentives under the other two criteria. And in terms of this issue, I know I went around this with the Council for Indoor Air Quality or whatever, but the statute reads, one, that they don't have to, aren't required to enforce it, and two, they don't have to have a building code. So, I mean, I understand that if they have a building code, they have to adopt this one. And even if they adopt it, they don't have to enforce it. So I was trying to focus on the municipalities where the issue would be most likely not generally observed if it's not even enforceable. In terms of the issue of, it's a voluntary program. So I don't see how it would conflict with a town's building code if it's having them do more than what is in the established building code. But it's only requiring them if they want to participate voluntarily.
Right. So this would apply. I mean, there's no way for me to tell which municipalities of under 4,000 have adopted this building code. But so this voluntary standard would be limited to municipalities under 4,000 residents who have not adopted the, a building code.
No,
But
that would not be my intent. My intent is that it would apply to all municipalities of less than 4,000 because none of them are required to enforce it, even if they have it by law. So there's likely to be more places where there are gaps, where there would be opportunities to try to improve performance or improve, actual living within the code type of thing. Because the law is like a two huge holes. Okay, one, you don't have to enforce it at all, and two, you don't have to have it. And so I would apply it to all municipalities, so there's no of 4,000 or less, just because I don't think it makes sense to try to spend time differentiating because it's a voluntary program that's only to help encourage people to do more. So it's not like we're putting an onerous burden on someone or a mandate. But my biggest thing was I wanted to include the same incentives we were offering landlords to the other two categories.
okay, I got that. That wasn't in the amendment
Okay.
that I had seen.
Yeah.
But
Probably just the way I wrote it was not well.
going back to the municipalities issue, although the state is not requiring a municipality to enforce that building code, a municipality would adopt that building code and require its enforcement. And so I honestly do not know enough about radon testing to compare the standards between whatever exists in that building code and the US EPA to know whether the US EPA is simply building on the main building code standards or whether there are conflicts between what the requirements would be that would differ between the US EPA standards. And so somebody could be in a position where I realize it's voluntary, but it would be getting at someone would be in a position where they would be restricted from even attempting to apply to that program if those codes conflicted. I think that their way to potentially get rid of the conflict is to change the standard for the home builders, that instead of complying with the US EPA radon preventive features, it would cross-reference whatever the standard is as it exists in the main building code. And then to the extent that any municipalities are not requiring that, there wouldn't be differing standards across the state potentially. The other piece of this is that in order to provide for an inspection, is that the inspections that are provided by municipal officers under Title 25, Section 2372, they are only authorized to inspect compliance with the main building code. So I don't know who would be doing the inspection under this voluntary program because nobody would be authorized to inspect for these other standards.
And that was part of the reason I had a provision about having a working group to work on the implementation part of it. But I'm happy with how you want to change it in terms of the EPA standard and changing that to the main building code standards. That's fine. I'm fine with that. But I just, as far as the other issue about the inspection, I think that would have to be worked out through this working group that I was hoping, or stakeholder group, to work on the implementation of it through the rules.
So
if that's possible.
Well, right. So to the extent you want the stakeholder group to review any of those things, we can add that to the unallocated language. But as I guess currently that I've drafted it, the statute supersedes the rule. So if the statute is saying something and the stakeholder group can't recommend something different, rules can't be adopted to something different than that. So if you want to delegate what standards should apply and who does the inspection entirely to the rulemaking process, that's a possibility too.
Okay.
So that section would say, in order to obtain the gold standard designation, a home builder constructing a new home in a municipality with less than 4,000 residents shall comply with any standards established by the department and rule relating to radon prevention features and inspection. And then then the statute wouldn't identify what those standards are, and those issues with the current applicable laws would be developed in rule. Like, that's a second way of handling it.
Well, I totally defer to you on statutory construction. So,
But that's a policy idea. So,
No,
so
okay.
it's whether you want to delegate all of that to rulemaking, or whether you want the statute to be fixed, as we've kind of discussed.
Well, I'm happy to delegate some stuff to the rulemaking. I don't know if we want to delegate everything. That's up to the committee. But I appreciate you making sure we dot our I's and cross our T's. Thank you very much, seriously.
So have you got the information you need, Aaron, to finish writing this up yet? The
So
answer
I
is-
need to know what option I'm implementing here.
Well, would it be easier if we delegate these kind of decisions, all of them, to this stakeholder group? Is that, or it's up to the committee how you want to frame that?
Senator Moore?
I guess what I would begin questioning then is that we did not vote on keeping the stakeholders group in the bill. So when we voted ought to pass as amended, that was not included in our initial amendment.
Really? Okay.
I thought you voted on Senator Baldacci's amendment as
Yeah.
he had kind of drafted it, and that stakeholder group was included in that. I guess I didn't, my notes didn't reflect that you took anything out of that.
Okay, well, maybe I'm misreading.
I'm
I guess
sorry.
I was just looking at your amendment here and I don't see reference.
It's in the unallocated section at the bottom in section 2. It's the very last sentence. The department shall convene a stakeholder group to assist in the development of the rules.
I got you. Okay, I do see that. Never mind.
Sorry.
So whatever the committee wants to do, I think probably, Aaron, I'll just ask this as a question. I'm not asking you for a policy opinion. I'm asking you for a statutory construction opinion. It would probably be more efficient to have those issues delegated to this group so that they can fine tune the exact requirements. That is a question about procedure, not policy.
Efficient in terms of how long it takes me to write it. I'm not sure.
You can take that word any way you want. It's just efficient.
I will do.
for the process.
Honestly, I mean, I'll do whatever. I think that at this point, either the language I've drafted that doesn't work needs to be tweaked in a small way, that, as we've discussed, or I just quickly put in another. I don't think timing on my behalf is an issue here at all.
Okay. Well, I don't want to make decisions for the whole committee. So I just want, that's why I wanted to know what the committee wanted to do. If the committee, first of all, I would go with your recommendation regarding the main building code instead of the US EPA. You're going to include the effective date, correct? And I would delegate to the implementing group some of the technical decisions regarding inspections.
And were you intending to include both air and water in the radon testing?
Yes.
That was the other unresolved issue.
Right. And I also wanted to make sure the incentives were supposed, and it was probably the way I wrote the thing.
No,
but
I've got a note to add it. I'm sorry that I missed.
no, I didn't. But so that was supposed to apply to all those different groups.
So I'll ask my question again of Aaron. Do you have a direction to proceed?
So I'm just going to list it off, just since so make sure we're all on the same page. I'm going to add the start date of July 1, 2022. I'm going to clarify that the radon testing is for both air and water. Remove the provision about inspection, and indicate that the inspection would would be in compliance with rules adopted by the department under section 2, and that's one of the things the stakeholder group would look at, and change the standards established by the US EPA to the standards for radon preventive features in the MUBEC, Maine Uniform Building and Energy Code.
Thank you.
Okay, thank you. That's enough for me. So I'm going to go on to something more simpler. Take a break for a second. LD 38. This was the act to clarify the timing of an appeal of the finding of involuntary mental health treatment at a designated non-state mental health institution. This was a department bill. The only tweak you had is that you reduced the time for the commissioner to issue a decision reviewing the order of a clinical review panel from 4 business days to 3 business days. And this morning I received the fiscal note, which says no fiscal note.
Best kind. Okay.
We don't get those very often in our committee.
I don't see any hands up. So next.
We have PFAS. This you asked. I'm just going to summarize what the amendments were. So you wanted. So we needed to add a mandate preamble because of the water, certain water groups that we were pulling in. You directed an emergency preamble to be added. Frankly, that's always a lot of creative writing on my part. And so if you see something that you don't like, please tell me, because I try to pull stuff from the testimony, but I get stuff wrong. And so the department's feedback was to add these 2 provisions, the last 2 whereases, is that there's currently no enforceable standard to require water systems to test and treat for PFAS, and that establishing a drinking water standard would expedite treatment decisions on contaminated private wells, in addition to PFAS substances being identified at alarming. That's not, me identifying that. I'm trying to pull that from other people, alarming levels, and that they're increasingly associated with significant health concerns that have major consequences. So I hope that is okay with you. The remainder of this was run by, at your direction, both the department and Defender Health. And so the specific amendments were to add the 6th PFAS contaminant, PFDA, I think is the acronym for that one. It changes in all places where it referred to 20 parts per billion or the US EPA level. It changed all of that from 70 to 20 nanograms per liter. My understanding is that nanograms per liter and parts per trillion are equivalent units of measurement, but I had heard that from the department that perhaps nanograms per liter was a slightly more precise measurement. So that's why I used that one. It clarified.
You're not seeing the.
Oh, you're not? I'm so sorry. I forgot to reshare my screen.
Thank you.
Okay, so here's at the top again, the mandate preamble, the emergency preamble with my creative writing and input from DHHS. Scrolling down, you'll see the other change here is to add that 6th PFAS contaminant as one of the regulated contaminants. Scrolling down in all the places where it had 70 parts per trillion or the US EPA level, it's been changed to 20 nanograms per liter. So just scrolling so you can see where those were. It clarified that the rules adopted by the department would be routine technical rules. And it requires the department to submit a report to this committee upon adoption of the final rule that includes information about the final rules, including the final MCL and that it gives you the authority to report out legislation relating to that report. And relating to the report, that the department would update the committee annually about the status of the rulemaking process and the interim testing process that went into effect with this bill. This one is just got put into the loops, so we don't have a fiscal note yet.
Okay.
1135 adds an emergency preamble. So this is a strike. So again, I hope that this information about substance use disorder and the effect of COVID being and waiting lists are the types of things you would want to see justifying an emergency. So if not, please tell me. At line 29 and 30, this change has to do with the date the rules would be adopted. So it's because it's an emergency, it's making them from January 2022 to October 2021. This next section has to do with when the rate increase effective date would take effect. So this goes back, it would be retroactive to July 1, 2021. Same format here. This first one is the date the rules must be adopted by. The next one is the date the 25% rate increase would be effective by. So it would be retroactive to July. Similarly, this new methodology would be retroactive to July, but the rules would be adopted by October. And other than that, those were the changes. And this was about outpatient services for SUD, SUD disorder treatment facilities, and then regular rules about, not rate rules, but policy rules about detoxification services and lengths of stay in a rehab facility. And this one's ready to go out the door. Oh, you have the fiscal note here. And if you're good with it, it can go out the door right now. Seeing none. 1424, you have seen this language before. We did a preliminary language review on it last week, I think, or maybe earlier this week. I can't remember. And it is substantively similar to what you saw. The department made some minor technical tweaks about how to refer to department rules, but that doesn't affect anything you've decided. And we received a fiscal note on this that shows that there would be a cost to change the educational requirements to for BHP professionals. And this one's also ready to be shipped out the door.
Okay.
LD 582, this bill was about amending the ACT team statute to make it more evidence-based and increase section 17 rates by 25%. That all exists in the bill. So the only thing that you are changing in your amendment is the rulemaking provisions, and you took everything out of the rulemaking provisions that were proposed in the bill, except that relating to the authorization period. And you changed it to 6 months for the initial authorization period, and the reauthorization period. In the original bill, it was at 12 months. You also directed a letter. I understand that's if this legislation is enacted, regarding the other rulemaking provisions that were removed in the final amendment. You wanted a letter about those. I haven't drafted the letter yet. I'll do that while you're in session and send that to you. Amendments are more important right now to get to the floor. We don't have a fiscal note yet on that one. Finally, sorry, I'm going to begin and end with one that I have questions on. This is the bill that Representative Perry's bill that establishes a study group within the department of Health and Human Services to review both the entire process of the progressive treatment program and also, where to go? Oh, it's in the original bill. It's also the entire commitment process. And so a question I had when I was drafting was that I know that you had wanted to expand the scope from what was presented in the original bill that kind of limited the review of the PTP to just the feasibility of and barriers to filing applications to the district court by those persons authorized to file such applications for PTP. So I included an including but not limited to that idea. There were other suggested topics that were identified in testimony by Maine Health, OHI, Disability Rights Maine, I believe. I don't know if you wanted me to separately identify those. I mean, this was the only one that the committee had specifically directed, but I just wanted to check to see.
What were the other proposed specifics?
They were things like oversight of, access to, and funding of the community providers supporting the individual subject to the PTP, access to independent examiners and judicial review. There were specific provisions about the hospital's ability to either hold patients or accept returning patients. And there were questions about just ensuring due process protections. That might not be a totally complete summary, but those were the big picture ones that I can remember now.
So since the bill sponsor isn't here, does anybody want to think that we should include any of those particular items? It does say the entire process, so.
I mean, that does cover it. I just,
I'm not seeing any hands up. Can we live with the way it is and not add anything?
it's easy for me.
And the other provision was additional people on the
Right,
stakeholder
so
group.
I'll go over that now. So I've separated them out into numbers instead of a giant paragraph that nobody can decipher. So you have the OAG, RPC, Northern Light Acadia, Spring Harbor, Maine Hospital. All of those were entities that existed in the bill as drafted. So the rest of these folks are ones I think that the committee has added, but I have questions about which ones. There are some overlap among several of them. So I want to make sure you're good with it. So we have a representative of Disability Rights Maine, a representative of the Consumer Counsel System of Maine. We have a person who is or has been a patient under, these are the commitment sections generally. A representative from an organization that advocates for family concerns, an individual who is a family member of somebody who is or has been a patient under the general commitment sections, but also a person who is the legal guardian of a person who is subject. This is just about the PTP. So they're different. I just don't know. You have a parent or guardian over somebody who might be involved in some way in the entire commitment process. You also have just the legal guardian, not necessarily just a family member, but the legal guardian of someone who's just in the PTP program. And then you have an advocate for organization that advocates for family concerns. And it's fine if you want to leave it that way, but there are, if, like Anna said, this would be a Venn diagram of like kind of interlapping groups. Similarly, I have the same question about providers. So you have a representative from the Alliance. You have the director of a team providing ACT services. That was added because they're one of the authorized folks to file PTP applications. You also have a representative from a community provider who administers the treatment plan of a patient admitted to a PTP. I didn't know if that meant other than an ACT team because you have that person here, but this could include an ACT team as drafted. You have one representative from a PNMI. So to some extent, 14 and 15 there might be some overlap, and there might be some overlap between 13 and 14. You also had a psychiatrist and a psychiatric nurse practitioner, both of whom would count as medical providers who would be authorized to file a PTP. I don't know if you want both, if these are sufficient to cover medical providers, or what you want to do with that. And then a law enforcement officer, because that is another type of individual who is authorized to file a PTP with the district court. So are there any clarifications about membership you'd like me to make?
Any thoughts? Is this a broad enough panel, a too broad panel? I'm not seeing any comments. So if you could stop screen share, you're done with this
Yes.
section, right? If you could stop screen sharing.
Yep.
I want to see if John Nutting, the Honorable John Nutting, has a sense, since he's worked so long on this, that this is an adequate study group. I know one of his concerns was getting a psychiatrist in. I saw that was addressed, and the nurse practitioners. Welcome, sir. Good morning, John Nutting.
Morning, I'm John Nutting from Leeds. You can hear me?
We can.
Yes, I'm pleased that the ACT teams and the Maine Association of Psychiatric Physicians is the official name of the Maine. It's not used to be the Maine Psychiatrists Association. Now it's the Maine Association of Psychiatric Physicians. That's just a technical thing. That's what they call themselves. And then the nurse practitioner, the psychiatric nurse practitioner are part of the Nurse Practitioner Association in Maine. So I think it's a very good broad cross-section of folks to have a thorough discussion. From me trying to follow along with the screen sharing, my only question was, are these various associations putting forth someone from their association to serve on the panel? Or is one particular person actually, who's naming the panel members? Are they putting forth their own representatives, or is somebody, I guess, picking from these associations?
So
the Commissioner of Health and Human Services is convening the stakeholder group.
So they'll do the picking, okay.
I don't know. I mean, this is a world I don't see, just like when you have legislators appointed to study commissions, somebody or members, somebody has forwarded somebody's name. And I've never seen that specified more than.
So if the associations wanted to forward a name to the commissioner, they would be, I assume, free to do that then.
There's nothing prohibiting that in this legislation.
Right, right.
Okay, good.
Thank you.
I'm sorry, I had a question about something Representative Nutting said. Are you suggesting that the psychiatrist and the psychiatric nurse practitioner be changed to a representative from each of those respective organizations, or is it okay as is?
Well, I think to be technically correct, you should say one representative from the Maine Association of Psychiatric Physicians and one representative from the Maine Association of Nurse Practitioners. It's just a technical thing, but that's what they call their associations now.
And I would keep the qualifier on the nurse practitioner as somebody who was doing psychiatric nursing.
Yes, yes. Yes.
Can you work with that, Aaron?
Yep, I think that's fine.
Okay.
Thank you very much.
Very good. Thank you, sir. Have a good weekend.
Thanks.
I'm sorry I didn't give Anna a heads up, but this is, I'm done talking for a
we're
little
gonna take a
while.
break. We're going to take a break here too. Anyway, Representative Stover.
I just had a question on the composition of the group. If there should be a representative from the Attorney General's office where there's discussion about commitment, if there's any interest in the statutory language around that, do you think that makes sense?
Yeah, it's already in there, Representative. It says at least as number one, not in any particular order. It just happens to be number one. at least one representative from the Office of the
I missed
Attorney
it.
General.
Thank
Sorry,
you.
I know things are moving quickly.
Very good.
And their
So,
the report back date is what, in December?
yes,
Okay, thanks.
with
Thank
the
you.
option to write legislation.
Yes, thank you.
Very good. All right. Anything else related to LD 869? Then I would propose, since we've been sitting for a couple hours almost, if we could take a 5-minute, 10-minute break. So it's 10:48 now. Let's get back together at 11. We'll split the difference and make it 11, 12 minutes. Okay. We'll reconvene at 11 o'clock. We're a third of the way through. So where is it? Your turn again, Anna? So ready when you are.
Okie dokie. So I am going to start with LD 496. So this is, I think this is Representative Gramlich. So this was a bill that you sucked two bills into. So this was 496 and 592 you combined into 496. So this is the original bill actually that you're looking at right now. I just want to draw your attention to the 30% here on line 17. And there you can see on line 17, you changed it from 30% to 25%. This is section 65 and 97, I believe. And then you added in LD 592, and this is section 65, and you made it 25% as well. So it keeps the emergency preamble and changes one from 25% and then sucks in the other piece, which was drafted as 25%. Also, these bills had appropriations in them, and by the time you get the bills, those numbers are different. And so I'm going to move to the fiscal note, which I didn't have when I sent out the amendment yesterday, but I forwarded it this morning. It is a significant fiscal note. 25% on a lot of services is a significant amount. This is the total right here of general fund, 9 million with federal drawdown and other special revenue. And then you can see that this will go on to the bill as part of the amendment. This is the appropriation sections to replace the appropriation sections in the bill, and it's broken down by account. So you can see the first bit there is section 65 in one account, and then 65 and 97 in another account. And then this one is 0147, and then this one is 65 specifically. So these are to update those numbers. So you knew there'd be a big cost to that, and there it is. So that one is actually ready to go now, now that the fiscal note has arrived for that. So unless anybody has an issue with that one.
Senator Moore.
I don't have an issue. I guess I just have a question. So these two sections then were not included in our 1360 that had eliminating the wait lists?
No, this is the eliminating the wait list is for the ID population as well as 63. This is a rate increase for 65 and 97. So this is a different population, different services.
Okay. So they were not included even that in our rate increase. Okay.
No.
So that may be something else we'll need to add to priorities then. Okay.
Well, that's a question for you.
I just added it to the sheet you sent me.
Thank you, Senator Claxton, because I was thinking they were all incorporated. So definitely an important one as well. Thank you.
Okay, so I'm going to move on if that's okay. This is LD 74. Oh, I think I have the bill here actually. This is the personal needs allowance. Yeah. So you change this from 40. This is the original bill you're looking at right now. This page. This was from 40 to 50, 40 to 70 originally. You moved it from 40 to 50. This is the nursing facilities. And then this was incorrectly drafted. So if you can cast your mind back quite a long way, if you remember the $70 is kind of a mistake in that there's a $50, this is for the PNMIs, there's a $50 personal needs allowance and a $20 federal disregard, and that was included sort of by mistake. So you changed this to $50 to $50 and to $70. So this is just a correction here. If you look at line 14 and 15, this is just the correction from $70 where it's really only 50. But what you changed it to was from 40 to 50 and 50 to 70. And then you applied the cost of living. So that should sound familiar to you. And then we got the fiscal note this morning, which I sent out, and you had some indication of how much this would cost because we had some information from Molly at the second work session we had on this. So there is an impact on main care. If you allow them to keep more of their income, then that requires more main care to make up for that cost of care. So that's the cost right there for that one. So hopefully that one is okay. So this is LD 287. This is a minority report. I think I have the bill here so you can look at it as well. So this is and I don't have the fiscal note for this yet, so you will get a fiscal note for that. We do know there is a cost to this, we just don't have it yet. So this is requiring the photograph of the recipient of an EBT card. So this part at the beginning here, this first sentence for the minority report stays as it is. And then the second sentence was, and if some of you can't remember this, is because it wasn't quite worked out during the work session, but I was in touch with the sponsor and the ranking member on this. So the problem with the second sentence is that it doesn't make any sense. So when a recipient of benefits is a minor or incapacitated individual, the commissioner may place a photograph of the recipient's parent or legal guardian on the EBT card. So it's already somewhat, I mean, obviously it's up to the commissioner, but it's already not required. And then if agreed to in writing by that parent or guardian. So it doesn't make any sense there. And also, when I went back and forth with the sponsor, a minor or incapacitated individual are two of the groups that are already exempt from, so there's federal law that allows states to have photographs on cards, but there are a number of groups that are exempt from that requirement. In other words, that the states can't require to have photographs on their cards, and minors and incapacitated individuals are on that list. So I talked to Representative Connor, and he said that it made most sense to him just to remove that. So I know this looks funny because you strike out the struck through part and you put back in the unstruck through part, which is the current law. So you will get a fiscal note on that eventually. And I'm sorry, Senator Moore, that I accidentally included you in that. So you will receive a fiscal note for that, but that is the minority report. So if there's no questions, I'll move on.
That really makes no sense.
It's the only way they can do it. There's just not a good way to do it is the problem.
We love it. We love it.
Yeah.
We don't understand it, but we love it.
It was one of those things where, you know, as a drafter, it's really nice to just be able to put the little stat underneath the existing law and let the revisor's office figure out what that looks like, because I actually wasn't really quite sure. So when it came back, I was like, oh, right, that's how they do it. Okay, so moving on. This is a majority report. This is the department bill, the licensing one about, this is the public health emergency piece of, it's not really a licensing bill, it's the public health emergency law, but as it relates to businesses that are licensed as eating establishments and so on. So this is, this is the original law that you are looking at right now, and none of this changes. There's only one piece that changes. So the issue here is, if you look at section 7.7 here, it says notwithstanding Title 5, section 1, whatever, however you say that, 10004, subsection 3, the department may suspend a license for more than 30 days. That's because Title 5, section 10004, subsection 3 only allows the suspension of a license for 30 days. So this section is to notwithstand that. However, when we went further down into this license suspension, that wasn't carried over into here. So it was internally inconsistent. So the amendment is solely to put that language into this section right here to make it clear that the intent is that the department in a public health emergency can suspend a license for longer than 30 days. And this is a majority report. And you can see that right there, which is the majority report. So that one should be easy. This is a bill. I don't remember what it looked like to begin. Oh, right. This is what it looked like to begin with. This is the bed hold days. So you had a problem here with the October 6, 2020 date, and I don't have a fiscal note for this. So this is another one that you will receive a fiscal note for at some point, and we will send that to you. So this is a unanimous report. This is nursing facility bed hold days and reimbursing for direct care. You've heard, I mean, direct costs. You've heard a lot about this during the budget and so on and so forth. So this is not a new issue. The issue was around this October 6, 2020 date. We can't go back that far. So you amended that to change it to July 1st, 2021, in the hope that they'll be able to do it within that quarter. And then this is bed holds to bed hold days was just a mistake that the revisor's office caught that I did not. And then you included the language that if CMS were to reject the state plan amendment request, then it would not go forward. So that's what this contingent effective date does. That should hopefully reflect what you expected. And Erin, I'm ripping along here just so you know, I've only got a couple more to go. I bet she's already such a girly swat. So this is LD 1064. This is another bill that we don't have a fiscal note for yet. And I don't really know exactly what it will look like either. I don't even want to hazard a guess. It isn't clear to me. So this is Representative Craven's palliative care bill. Welcome back, Representative Perry. I hope your cat is good. So this was the bill that around the interdisciplinary team. You did a number of things to it. This is the amendment. Yes, just the amendment. So you had struck out the part around standardizing palliative care and kept the piece. This is the main care section to provide reimbursement as an interdisciplinary team. A lot of this looks very much like the original bill. You made a couple of tweaks to it, which meant that it had to be a rewrite. So you included, sorry, I just got a text that made me laugh. So thanks, Molly. I just lost my train of thought. So oh yes, I know what it was. So you had the department using national standards for quality palliative care and developing the rules, which are around the team approach. And then you also had a stakeholder group. The revisor's office didn't like periodically, but I told them that they had to keep it. And that's because this group is not around developing the rules, it's around letting professionals know that the main care reimbursement has changed to this team-based approach. And so you had this language around the stakeholder group to advise the department on educational materials and outreach. Outreach was not actually what you voted. You had a different word there that made the revisor's office go, what on earth does that mean? Didn't like it at all, neither did Erin. So I worked with a couple of people, and outreach, I believe you had strategies there, and nobody knew what that meant. And so I actually asked Lisa Harvey McPherson, since this was an issue that I had worked a lot on around this, and I'm like, is outreach what you mean? Because this is about telling providers that this would be a way that they can bill. And so hopefully that change is okay with you. And then you have the rulemaking standards. This is where you specifically referred to the clinical practice guidelines developed by the National Coalition for Hospice and Palliative Care that you could not put in statute. So you put that in here as one of the possibilities that they could consider for national standards. And then of course that requires a state plan amendment. So as I mentioned, that's one more that you don't have a fiscal note yet for. So that will come along, but hopefully that looks like what you expected. Okay, and then the last one is Senator Baldacci special. This is the estate recovery bill that was 12-1 ought not to pass bill. And Senator Baldacci voted fiscal note only. This is the bill that would allow for more people to be paid for looking after their family members and then claiming it in their estate recovery. And so we knew there would be a fiscal note for that. We just didn't know what it would look like. And as I mentioned, this is just the minority report for one person. I don't know if he's back from VLA, but if not, you all needed to see it so that you would know that it was out there. And he's not back. Okay. Your turn.
Are you ready for the next batch?
Yes.
Okay. This is LD 972. You had tasked me to work with Representative Craven and the stakeholder from the rare disease, the national organization, around clarifying the duties and the membership of the council. So just gonna leave this up. This is the members. These are the members. Includes various healthcare providers, epidemiologists, main care. We added the superintendent of insurance, person representing an insurer. This one had said biopharma. The revisor's office didn't like it and suggested biopharmaceutical companies, which I think captures the same intended group. A geneticist, person representing an academic research institution, 2 persons who are adults with a rare disease, 2 parents with a child with a rare disease, and any other temporary members as determined by the council. The duties of the council were reworked here largely to remove some of the research directives that the council would have had to do. And then it just clarifies some of the outreach requirements and who recommendations would be made to from the Rare Disease Advisory Council as part of their annual report and the comprehensive plan that this group is tasked with.
So on item I, is that a new phrase I should be learning, without limitation, as opposed to unless otherwise specified?
Yeah, that's a good one. Or including but not limited to,
Yeah,
or
right.
notwithstanding any other provision of law to the contrary. Those are the catch-alls.
Just trying to learn something.
Yep. And we have the Perry amendment here to report out
A little better
legislation.
now. Yeah.
And then we added in the staggered terms, which is standard, just so that everybody isn't up for reappointment at the same time. And the number, the how the appointments broke down was a new math problem based on the expanded membership. This one is just waiting for a fiscal note, but otherwise it's the language is final. The next one is LD 1305. You saw a draft of this in your email that the sponsor, Representative Morales, and Meaningful Justice had created. This is a version, this is the drafted version from that draft that was shared as is, I believe, or with only minor tweaks when it went through the loops with the department. With the Department of Health and Human Services, Maine State Housing Authority, and Maine Equal Justice. And this is the bill that talks about collaborating between the Department of Health and Human Services and the Maine State Housing Authority to increase access to housing assistance programs between those 2 departments.
Mm-hmm.
And there's a report back with authority to report out legislation. And this one is also waiting for a fiscal note.
Okay.
1470 is the bill about the Sanford Psychiatric Institution. The only change here is a delay in the effective date from January 1 of this year to October 1 of this year, and that had to do with the availability of federal matching funds based on the quarter in which the change would be submitted to the federal government. It also just clarifies that the rules are routine technical, which shouldn't be a change from how those rates were established anyway, but they like to, anytime we talk about rules, like to identify it one way or the other. And we're waiting on a fiscal note on this one. Uh, 1601, this was Representative Zager's study about genome editing technology. The only change was in the way it referred to one of the members on the study. It is striking out a person of the Wabanaki people and inserting instead a person from one of the federally recognized Indian nations, tribes, or bands in the state, and that's consistent with other study group language that has been reported out this session. And this one's also waiting for a fiscal note. LD 1603 is about the Universal Basic Income Security Study. You can see that it strikes out all of section 1, which was the part of the bill that would have established the committee to improve the effectiveness and accessibility of Maine safety net and work support programs. So it struck it out there. There was also a lingering reference to that committee in the substance of the UBI study language. That's also being removed here. In the course of, so the fiscal note on this isn't quite yet ready. In the course of some of those discussions, it came to our attention that there is some money left over from money the committee raised last year. Based on how the bill is drafted right now, that requires the committee this time to fully, quote, fully fund the cost of the study. That leftover money would not be available. But if the committee wanted to authorize the use of the balances from the prior year and remove that fully funded language, then some of that money from the prior year can be applied, and I believe it's a little less than $6,000. You don't have a fiscal note on that yet. Obviously, it would account for that change if the committee goes there. It also would assume a cost of the feasibility study of $25,000. So is that something the committee would want to authorize to use the unexpended balances from last year?
Show of thumbs.
Okay.
Okay.
I see 3 thumbs. Everybody else, I can't see
I
anybody
can't
else.
see anybody else. That's a scan. That's right. If you don't agree, put up your hand. If you do agree, show your thumb.
Okay, and then Anna, this is my last one for now. This next, so I'll make that change, and you'll see that. You'll see all of these back at some point when we get the fiscal note on those. This one is the bill about increasing the number of intensive case managers. And I think I need to actually add the word intensive to that title. That's just an oversight on my part. Primarily, the bill is an appropriation section to add funding for 4 ICMs to the Department of Health and Human Services. There was a preliminary fiscal on this bill that indicated, I forget exactly how much, but you have seen an estimate of what those numbers are before in your consideration of the bill, and OFPR will finalize that. And then you have the request to have the department report about how the ICMs are distributed geographically, how much time they spend in each county, and how much time they spend with both the incarcerated population and the reentry population, with authority to report out legislation. There's also a letter associated with this one that I would write if enacted that would encourage the department to spread out the ICMs in a particular way geographically. But again, letters are not priority right now. So, and you haven't enacted it yet. So I don't know if I need to write that letter.
Don't write the letter yet.
And I still have more, but I'm going to turn it over to Anna while I pull those up.
Okay, I am going to start with LD 1262. I probably have the rest of the bill here. Yes. So this is the bill requiring the strategic plan for behavioral health needs, LD 1262. You made a couple of changes. The first is this issue with in here in the plan participation with drafting the plan in collaboration with these organizations. You took out the legislature out of that because that doesn't actually make sense. You can't collaborate with the legislature in a practical sense. There were some other changes as well, which I can't remember off the top of my head, but that's why we have it here. So this is the only change here is the removal of the legislature. It's just easier for the revisor's office to put it that way. Oh, and then this is just a correction. The department, this is the revisor's office catching that it should have said the DHHS. So the only practical change that you made was removing the reference to the individual. Oh, that's right. You removed the individual officers that were required in here because they're somewhere in here. Because it must be at the beginning. Yes, this is the other change. This is because it said the Office of Behavioral Health and the Office, and it doesn't make any sense to do that because you want all of the officers. So you remove that as well. So that's why it is a replacement of that. So that's the only practical change that you made to that. And oh yes, and you clarified that the department will seek public input. That is in the same paragraph. So that one, we also received the fiscal note today. I did not scan it and send it to you because it seemed unnecessary, because it is one of those cost absorbed ones that means that it doesn't go to the table. So I'm moving on. This one, we don't have the fiscal note yet, but you have seen this one many times. So I did not scan the whole bill for you. This is Representative Madigan's bill that is both the OAB, which is not part of the budget, and the Aging and Disability Mortality Review Panel. It's still out there. This is the sole change that you made to it. We also don't have the fiscal note yet. We know there's a position attached to it, and when we get that fiscal note, we will pop that thing right on there, but we do know there's a position associated with it. If it gets in the budget, then you won't need the bill, or well, you won't need the position. You won't need the parts that relate to the Mortality Review Panel. You may still want the parts related to the OAB. But you will receive that fiscal note, and I'll just send it along by email when I get it. But that one is also of no surprise. We just don't have it yet. So moving on to the next one. This is unanimous report. I mean, a 12-1 report. This is the original bill related to contracts that was a 12-1 report. An ought not to pass report. Representative Madigan did vote for that. The only change was to correct the language to, this isn't going to be right in the end either, but at the time, you have the quality bill that is still out there where the language changed. Whenever that bill ends up being changed, this will end up still being incorrect. So if it goes forward, it will end up in the errors bill, but there's nothing we can do about that. And the other thing I wanted to mention is that we also did receive the fiscal note for that minority report today. That also, because it's may go out to bid, may have contracts. There's nothing required about it. So that is a no fiscal note bill. I mean, a no fiscal note amendment as well. 1649. This is the bill about shared living. This is the one where you change the language of the contingency account. This one at least is recent, so you probably can remember this one, unlike some of the others that I'm throwing at you today. So this was the one where you just broadened the use of the contingency fund so that anybody who qualifies for these services would be able to use the contingency fund, and that would apply to persons living in shared living as well, because you can see it struck out all of the specific circumstances and allows it to be used for anybody who qualifies for services. We also received that fiscal note today, which is a no fiscal impact. So I didn't fill up your email with that one either, but this one is also ready to go. And this was a unanimous report as well. LD 629, this is the task force for criminal cases of violence against hospital workers. So you've seen this language multiple times. You just made a couple of changes to it around violence in hospitals and other healthcare facilities and settings was language that you changed from what you had seen. But the rest of it you've seen multiple times because it came from the sponsor. We don't have the fiscal note for that yet. We know there will be a fiscal note because it is a legislative study, and I expect that it will look like the fiscal note for every other legislative study, which is there's $10,000 on the study table, and you know that's what the budget is. That's how they always write those fiscal notes, because we know how much a study costs. We just don't know which studies are going to get funded. So the fiscal note will say how much the study costs and how many meetings they assume, which is usually 4, and you know how many legislators are on it, because they're the ones that get paid, and then it will include the $10,000 limit for what's on the study table. But we don't have that one yet. I just know what it will look like when we get it, which is unusual. So that's that one. This is the resolve for ambulance and PT and OT. So if you remember, I had to bring this one back to you with my mea culpa. This language had originally been drafted to be in statute. I told you that I could draft it so that it would. That's my husband calling me. I'll have to ignore that. I don't know how to stop it ringing. I'm sorry. So this is the language that directs the department to change the rules around ambulance services so that it includes the add-ons for rural, urban, and super rural in the same way that they are in federal law and federal rules. And then the PT and OT language came straight out of the bill from last year or the year before with the new date. That will have a fiscal note, and we don't have it yet, so that will be along when we get it. And Erin, I'm on my last one again. Although before I do the last one, I do want to mention 488, which is Senator Maxman's recovery community organizations. You know, I brought that back to you yesterday or the day before or whatever day it was to talk about the end date. You probably only remember because I told you I fired it across the room. I did want to mention that I did get the fiscal note for that too, and as you expected, that is an absorbed cost as well. That was the point that Senator Maxman was trying to get at, to get rid of the fiscal note by prioritizing among the RFPs that were already going to go out. So I just wanted to mention that I have that because I also did not scan that, but that one is also going to be ready to go quite shortly now that you told me what the end date should be. So the last one, the seed bill. This is the original bill. It was originally, this is Title 10. This is the profiteering section that added seeds to it. General assistance was on there. You struck out section 2, so that's what the amendment looks like. I don't have the fiscal note for that. I can't imagine why there would be a fiscal note. Obviously, if such a thing should occur, I will bring that one back to you. But that one just strikes out section 2. You all good on those?
So how many bills do we have still outstanding other than the 488 you just referenced, Dana?
Do you mean today, or do you mean not today? The ones that we haven't done and you don't have for today?
what are the ones we don't have language
At all.
review? Yeah.
Okay, so there's a little girly SWAT among the two of us, and Erin has drafted all hers. So you can see the little halo from here. She's hoping that it won't fall down and strangle her. I have 9 left.
Okay.
And I shall tell you what they, and this is not counting fiscal notes, obviously. So I'm going to tell you what they are, since you have asked me. There is LD 614, which is the VA bill. That's the main veterans home nursing facility bill. I'm going to go slow because I know Senator Moore is going to be writing them down. 296, which is the caregiver bill. What does that mean? Well, 296. 727, that's the bill that, this one's way back to the beginning. This is removing the asset test. 1204, which I'm hoping to talk about before the end of today. That's the one that allows parents to care for their children if they qualify for services. And I'm going to ask you some questions before we get done with that because I'm having a problem with it. 1543, which is the home care telehealth bill that everybody agreed on, and Lisa Harvey McPherson and Bill Logan were at the work session, and they're going to have to draft it because I don't understand it. But I'm not worried about that because they're smarter than I am. 1241 is the Representative Fecto's licensing transparency minority report. I just haven't gotten to that yet. 949, that's the nursing facility bill for Senator Baldacci, the funding bill with all that crazy language in it. 854, which is, it won't be crazy when I'm finished with it, Representative Perry, I saw that. 854, that's the Section 106 services for the developmental preschools. And 1586, which is Representative Warren's, that's a long message he just left me. LD 1586 is the Representative Warren's crisis bill. So those are the ones that I have left, although I am hoping to ask you some questions about 1204 before we're done. But the little girly SWAT there, she's going to carry on now, having drafted all of her bills. And she gets to read all mine too, so she has double work.
Purely out of my own self-interest, so so that I can see my parents this weekend.
Got nothing to do with self-interest.
Okay. This is LD 718. This is Representative Talbot Ross's bill that would expand the main care program and the Children's Health Insurance Program for non-citizens who would otherwise be eligible for those programs, but for their immigration status. So I had thought that I might be able to, I think I foolishly thought that I might be able to restructure this in a way that moved some of the CHIP provisions in the CHIP section, for example. In my conversations with the department, I realized how very little I know about how these programs actually work. And I decided not to do that because at this point in session, I was more, this does it, you know, like as drafted, and I didn't want to get it wrong at all. So this is how the original bill looks. The only change that I am making is to clarify, and I hope this is okay with the committee, is to clarify that when it talks about persons who might be ineligible for coverage due to federal restrictions in federal Medicaid and CHIP, that it's not any federal restrictions on those programs, but it's the federal restrictions relating to a person's immigration status specifically.
This is the majority report.
This is the majority report, correct? The minority report was on not to pass.
Mm-hmm.
So otherwise, okay, I'm sorry, Senator?
That sounds okay to me.
Okay. Good, thank you, because I felt like I was giving up. I had to go seek permission from Anna and to make me feel better, but I think it was the right decision not to mess with it. 745, this was the bill that, as originally proposed, changed the statutes to expand the Universal Child Immunization Program to include adults. The committee's amendment changes that to a study within the Maine Vaccine Board to convene a stakeholder group to review the possibility of expanding the immunization program to include adults and make recommendations to this committee by next year, including any suggested legislation about how that could be accomplished. I got in trouble with the revisor's office by indicating that you want the sponsor of the legislation to be consulted by the board. I think the problem is that we're supposed to refer to office holders. So like, I don't know, the chair of HHS or somebody like that, or the commissioner of the department, as opposed to like a specific person. One of the ways they suggested to fix it, if it's okay with you, is to direct the board to seek input from the chairs of this committee, the Health and Human Services Committee, to get input from a legislator that would be interested in this process. And then presumably the chairs would say Representative Millett. And I mean, everybody knows that Representative Millett wants to be involved. So I think it's just a technicality, but we do need to fix it to say something else.
Okay.
So if that's cool with you, we can go with seeking the input from the chairs of HHS.
Yeah. Representative Perry?
Yes, I was wondering if you could say a designee of the chair of the Health and Human Services, which would allow the sponsor to be involved.
I hope so. I mean, I think so. It's not a rule that I entirely understand, so I'm not able to help generate ideas to fix it. So I was just relaying their idea to fix it, but I can try that. It would be like a legislative designee. Is that right, Representative?
Yeah.
Okay. So if we're good on that one, this is the bill about the reporting of firearm fatalities and hospitalizations. So one of the amendments was to remove this reporting requirement from the CDC director's annual report to the committee, which I didn't know existed until I saw this legislation. I don't know if I've seen that report before. But so this puts a new chapter in the public health part of Title 22. And it directs the CDC director to report annually beginning next year to the Joint Standing Committee having jurisdiction over health and human services matters relating to, and this is the majority report, public health data concerning firearm fatalities in the state, separated by the number of homicides, including those by DB, and the ages and the ages of the victims, suicides, and unintentional discharges. I think the bill as drafted used the term accidents. So this was a recommended change from the sponsor when she presented this to you at the last work session. It also removes under the firearm fatalities the requirement that the firearm, the type, make, and model of the firearm used be removed. In terms of the hospitalization provision, that section I believe is unchanged. I did get a question from my reviewer questioning why the type, make, and model of the firearm would be included in the report of hospitalizations, but not in the report of firearm fatalities. And I don't know the answer to that, but I'm just flagging that for you if maybe somebody else knows what that reason is. The sponsor's amendment also added a directive to have the Commissioner of Public Safety, the Office of the Chief Medical Examiner, the Office of the Attorney General, and Maine Health Data Organization to assist the CDC director with collecting the data that's required above, and that the director would make that report publicly available. In addition to operationalize this, there's an additional category in the Uniform Crime Reports under Title 25 to include information about unintentional and intentional shootings.
So before we kick around anymore, the issue of whether we want to include more information in the hospitalized section than the fatality section, which seems kind of shaky. I'd like to hear from Katie Harris, if you had something to contribute.
Thank you very much, Senator Claxton, Representative Meyer, members of the committee. We have not followed this carefully. We're very comfortable having more data collected, but it just came to my attention that the make, model, and firearm used it appears to be that we would have to collect that information, and I have no idea how a hospital would be expected to collect that. So that raises a lot of red flags and concerns for me, and I just wanted to bring that to your attention.
So for those of you who voted for the minority report, any thoughts about striking that language for related to hospitalizations? Senator Moore.
Actually, the minority report I thought was ought not to pass.
That's right. So this is the majority report.
I was talking about the majority report.
I'm sorry. Okay.
This is from that. Yes. Representative Craven?
Yeah, it makes sense to me because I think that it would be impossible for the hospitals to know that unless, unless the presiding officer on the scene would be required to tell them or something.
Which doesn't always happen. Okay. Any other thoughts? Are people who voted in the majority okay with striking that language from the area under hospitalization? So I'm looking at Representative Meyer. I see Representative Stover's got a thumbs up. Okay. All right. So Aaron, why don't we just strike that language from that section, and Ms. Harris can take the good news back to the.
Yes, thank you very much.
That is easy enough. All right. This is LD 1548, which is a resolve. Well, it was an act. It's being converted to a resolve to alleviate the disproportionate impact of COVID-19 and public health outcomes. It was based on what the sponsor proposed at the last work session, which would be to remove the emergency and replace the bill with a resolve that directs the Department of Health and Human Services and the Permanent Commission on the Status of Racial, Indigenous, and Maine Tribal Populations to determine the appropriate levels of funding needed by historically disadvantaged communities, including the federally recognized tribes, nations, and bands in the state, in order to build community-based infrastructure and achieve health equity. And in order to do that, it specifically directs the department and the commission to review the availability of federal funding that the state has received relating to pandemic stimulus funds and existing programs and funding to support historically disadvantaged communities. I have a couple of, I just have one question on this bill, and that's about paragraph 3. The amount of state and federal funding that has been directed to historically disadvantaged communities and any outcomes data or information related to that funding. Because the amendment that was proposed didn't have any kind of time frame for that. So I don't know how far, that potentially this is drafted as to include like from the beginning of time kind of funding that communities have received. So it might be helpful to put some kind of time period barrier around that.
Because that's present in the first two.
Right, but the amount of federal funding from COVID is identifiable because it started in 2020. But in general, the amount of state and federal funding that has been directed is that it doesn't say that that's the same period of time.
No, I understand that, but that's why you're looking for some better definition of time frame. Representative Stover?
I wonder if on number 3, because I can't think, you can't go back to the beginning of time. So to establish a baseline, fiscal year 21 is the year we're in, or even fiscal year 20. So you establish what was that baseline historically as you move forward. I can't think of an easier way to do it. And I don't think long historical data is going to necessarily matter. I think just establishing a current state and then going forward. Does that make sense?
It does. What you lose out though is on any trending data. If it was 5% in 2000 and 15% in 2005, and it's now 10%, then something changed. So,
Well, we could pick a reasonable amount of time that wouldn't be a daunting
right.
dig.
Luke probably has this already figured out, but
I bet he does.
Well, he just got it yesterday.
Oh.
So that's a quite a high compliment to Luke.
It is. It was intended as such. It was intended as such.
Yesterday evening, I believe.
Oh, okay. What do folks think? There goes a cat across the screen.
Oh,
You can tell the cat people in the room.
He's doing well after his vet appointment.
So what do folks think about 2005? Go back 5 years, 2000. Any sentiments? How about we make it 2000 and make it back 5 years, 2005, unless there is a real good reason to look back further or something
I
like
think
that.
that's 15 years ago, Senator.
Oh yeah, that's right. Time
I
flies when you're having fun.
was in
Okay.
college.
I told you there'd be technical difficulties. They were just between my ears. Let's go back 5 years and use that. Representative Craven?
Well, I was going to comment on going back that far because, we've had recessions and this and that. So it would be skewed in a way that wouldn't be during normal circumstances, would it?
2000 would get us back before the big recession.
I think 5 years is good.
Okay. Representative Stover, can you live with 5 years?
Absolutely. Thank you.
All right. Thank you for that. So there you have some direction.
Thank you for that. Okay, LD 1550 has 2 reports. This is the majority report, which was a fiscal note only. So this would be the and it looks like we don't normally see this, but there's also correctional and judicial impact statements. So this meant that more than one analyst in OFPR would have had to look at it.
Okay.
This one, so there's no language with that. It's just a fiscal note on the majority. This is the minority report, or one of the 2 minority reports rather, because the other one was on to pass. I proposed changing the title to end the sale of flavored vaping liquid. It appears this amendment is intending to prohibit someone from selling, distributing, offering to sell or distribute, giving or furnishing flavored vaping liquid that has not obtained a tobacco product clearance order or a modified risk tobacco order from the US FDA. And so the structure of this is a similar structure as used in the flavored cigar structure currently in subchapter 5. It defines characterizing flavor, but specifies that flavor does not include tobacco or menthol. And it provides that if the vaping liquid is advertised or marketed as having or producing a distinguishable flavor, then it means it has a characterizing flavor as used in this subchapter. It uses the same definition of electronic smoking device that exists in other sections relating to smoking. And it defines flavored vaping liquid to include any vaping liquid by itself or in combination with an electronic smoking device. that has obtained a tobacco product clearance order or a modified risk tobacco product order from the US FDA. And vaping liquid is defined as a solution that contains nicotine, which is designed or sold for use with an electronic smoking device. So the sale of flavored vaping liquid as it's defined above is not permissible, and a person who violates that commits a civil violation. The fine for the first violation would be $100. The draft amendment that was presented to the committee indicated that if someone had previously been convicted of a violation, that it would be a $1,500 fine for each violation of the chapter in, quote, cases when a person engages in a pattern of conduct that demonstrates a lack of good faith in complying with the subchapter. The way we draft civil violations is very formulaic. I've never seen such language. Doesn't mean it doesn't exist, but that's not language we would typically include in a violation section. So I've taken the liberty and I'm explaining it. I hope it's okay with those on this report that this is the similar structure as any other civil violation I've seen, that if someone has previously been convicted of a violation, then the subsequent violation has this higher penalty amount. And this is the same penalty amount included in that proposed amendment.
And I'm fine with that, Erin. That's good.
And this one has, I think, was delivered to everybody this morning, meaning the other offices. So you don't have a fiscal note or anything on that, and it needs more processing. One of the benefits of remote meetings is that you have no idea how bad my handwriting is. It's worse than Anna's. And so that's something you'll be wishing for remote meetings next session when you see my scribbles everywhere. But this is the markup on 1570, which is the arsenic testing bill. And so you can see here that it limits the testing program for low-income residents for arsenic. And this sideways language says, as used in this section, low-income resident means a person who receives assistance under the main care program or the food supplement program. For some reason, the revisor's office doesn't typically have problems reading my handwriting, but I can't read my own sometimes. Similarly, here it limits those tests to arsenic. This is the landlord testing section. It replaces the term periodically to every 5 years, and promptly with regard to providing notice to within 10 days. The revisor's office noted on a draft I just got back, I think this morning, that promptly in relation to new tenants might, within 10 days in relation to new tenants might not make sense practically, but that's a decision that's ultimately up for you to decide. Right now it says the landlord shall within 10 days notify any new tenant of the most recent test results of a test conducted under this section. This section, also limits this to landlords of residential buildings. And one of the other questions that I received on review was whether there needed to be a start date. So kind of every 5 years beginning when, if it's something other than, I think, the effective date of this act.
Any thoughts about that from the committee of those two issues? Do we want to treat new tenants differently than existing tenants? And when do we want this to start? I'm not seeing any hands up. So I'm not sure I understand why we would need to treat new tenants different from existing tenants. Yes, Representative Meyer.
That was going to be my comment.
Okay.
I don't see why there needs to be any differentiation there.
There doesn't have to be. I just got the question, so I'm putting it in your hands.
Yep.
The obligation is to test and inform,
Yeah.
right? There's no other additional work for any landlord, new tenant or existing tenant. It's a test and inform.
Right.
Okay.
And then the other question was about a date. Is this going to require some rulemaking?
It doesn't say it. No.
No. So we don't need to build that in. So January 1
That
to
was-
give
Yeah.
January 1, 22.
Yep.
Okay.
That gives
The
people a
the next
chance to get started on doing something about that sooner than later.
So the next two sections replace all of section 8, which I've crossed off here. So the new section 8 right now, as written there, is identical to the unallocated language in the original draft of Representative Fairmonk's Bill 1943 last session. It says the Department of Health and Human Services shall review recent research regarding arsenic toxicity and levels suitable for consumption, and shall amend its drinking water rules to revise the MCL for arsenic to be consistent with that research. One thing that I'm just flagging, you don't have to change it, is whether the directive for the rules to be consistent with research only relating to arsenic toxicity creates a limitation on the department to not consider other factors that might go into establishing an MCL, such as some concerns you heard from the water districts. It's fine with me. This is a policy decision if you want to leave it as is, but I'm flagging it as kind of like informed consent for the committee to know that this appears to have the department only able to adopt an MCL that only takes into account arsenic toxicity.
Anybody want to adjust that? Consider changes to that? Yes, Representative Meyer.
Thank you, Mr. Chair. What would the language be, Erin, if we did open it up to consideration of other sources?
I think there's no problem with the shall review the recent research regarding arsenic toxicity, because it doesn't prevent the department from reviewing whatever else they need to review in order to adopt the rules. And I think if it just said, and shall amend the drinking water rules to revise the maximum contaminant level for arsenic, period, then that would not provide the limitation that I've identified.
What do you think about that change, Representative Meyer? Does that make sense?
I think it does.
Yeah. Any other comments about that? Not seeing any. Why don't we go with that, making it a little bit more flexible? We could always use the including but not limited to, but just eliminating words is better.
Okay. And then this next unallocated section is about rulemaking. It directs the department to include in its annual report required to, this cross-reference is the annual drinking water report, information about the status of adopting rules in accordance with this section 8 about the arsenic MCL. So I have one more, if there are no questions about that one.
Sounds good to me.
This one was one of my favorite amendments to draft because all I had to do was cross off this date and write this date. And you can see my reviewer asked the same question I asked you during the work session if you wanted to change these dates, but the answer to that was no. So the only change in the amendment would be delaying the start date for the pilot projects to January 1, 2023.
Very good. Sounds good to me. All right. So how are we doing with what else is on the agenda?
I have 4 left.
You You have 4, and are any of them long complications?
No, I do
Discussion?
have a conversation about one that might take a little bit of time, but no, I think that you would probably want to finish before you had your lunch,
I was going to say, are people okay to continue going? Yeah,
because then you'll be done. Okay.
done is good. All right.
I thought you might like done. Okay. Oh, I'm sorry, I forgot about this is LD 958. This was originally drafted, this was Senator Maxman's bill. You've got to think back a little bit to this one. This was originally drafted with a long list of all of the sections of main care and state funded programs that are home care. And this was about, enforcement and, people not turning up to work and, taking advantage of people and all those other things that you heard about, background checks and so on. And what you agreed to and the sponsor agreed to with the department was to have the department review its statutory regulatory authority over home care agencies that provide direct care services. And the review must examine whether the department has sufficient oversight and enforcement authority to ensure quality and safety of people who are receiving the services. And that would include stakeholder groups, and the department would report back to you. So this was because the department it was unclear to the department whether they had the statutory authority to do enforcement. So and in some of these, particularly the personal care agencies, I think that's what it is, the PCAs. So that was a straightforward stakeholder group and study, and they'll report back to you whether they do need some changes to their statutory authority. We don't have a fiscal note for that, but I would be surprised if there was one. So that one should be okay.
Yep.
Okay, LD 432, this is still in the initial stages. This is Representative Madigan's collateral contacts bill. So if you can cast your mind back to this one, this is about the professionals that are meeting with other folks on the team of people who are working with children for home and community-based treatment. And the bill as drafted turned out to be less of an issue in terms of who they could meet with than the number of hours and the methodology. And so you voted to increase from the current 10-hour cap to 20, and also allowing for those collateral contacts to be virtually or by telephone in addition to the face-to-face, which is currently in rules. And then you also, and this was the trickier part to write, you also decided to have this for Section 28, which is the ID side of the children. And they currently do not have collateral contact hours. They have case management hours. So and the reason you picked 24, even though you had 20 for Section 65, was because they currently have 24 hours for the case management, and so this would just mirror that language. And so you wanted to include the collateral contacts for those folks, as well as the same face-to-face, virtually, or by telephone language. So we don't have a fiscal note for that. We know there'll be one because now you are paying for more hours than are currently being paid for, but we don't know what it is yet, and we'll send that along as soon as we get it. But there was a little bit of a fiscal note when it was originally drafted without changing the cap, because there may be some people who don't reach the cap. So we do know that there will be a fiscal note, but we'll send that along. But I see Representative Madigan nodding at me, so that's good. And I'm glad she's one of the people that shows up on my screen, so that's helpful. LD 330. This is Representative Gramlich's bill that was originally drafted to do something a little bit different, and this is the one that this is about hospice agencies and disposal of medications after the person has died. And you had a couple of quite long work sessions that included Lisa and Bill Monteo about what's currently required, because a lot of this is currently required by federal regulations in terms of a hospice provider who goes into the home providing a written policy. Like, that's something they already have to do. It was drafted at the work session to require a standardized policy. You agreed not to do that, but to have a minimum standard in statute and not have a standardized policy because nobody really, I mean, a standardized document because nobody decided that nobody wanted that. And so there's been a little bit of wordsmithing since then with the department and with Lisa. And so the policy includes, but is not limited to, clarification of the roles of the hospice provider, client, and family in terms of prescribing and administering controlled substances, the safe use and storage of those controlled substances. And this, remember, this is the policy that's being given to the family and the client. That disposal is expected. That should be safely, obviously, not safety, safely and appropriately disposed of afterwards. Information on how to do that. And then this disposal method language had to be wordsmithed a little bit because it wasn't, you know, I don't know how this works. So you had the mail back envelopes and disposable kits or whatever is available, but that has this consistent with current DEA recommendations and requirements because it wasn't clear who would do that. And we certainly know that those things change. And then you had the notice of letter after death that you would give advance notice that the hospice provider would send a letter after the client has died with a reminder that the client is expected to dispose of medications, and then the documentation, which is also something that's already required by federal regulations. And then this was the piece that you saw at the work session that had been added that is different from the regulations, that the hospice provider shall send a letter to the family of the client within 30 days of the death of the client, stating that the family is expected to dispose of any medications with the information on safe and environmental disposal that was provided at the time. And then the department has the minimum criteria for the written policy. They did not want to make rules about this because it, you know, that's more work. So I changed the section that it was in. It was originally in 8623, I think it was. It was in the rulemaking section, so I made it its own section. And so, you know, this is the requirement that the department establishes those minimum criteria, which they are perfectly willing to do. And I do just want to draw your attention to a couple of other things that are on here, in case you have the same questions that other folks did. The definition of family there's a definition of family in this chapter, which applies to hospice providers, and it does include other close individuals. In other words, if this doesn't exclude a person who is receiving hospice in, my light just went out, receiving hospice in the home of, say, a friend. So they would be included in this, even though you don't normally think of the family as including a person who's not biologically related. In this case, it is defined to include that. So we went back and forth a little bit on that. So that is included in there. And it also, I just want to remind you that this is about home care specifically. So hopefully that looks like what you expect as well. Nobody's shaking their head at me. So the last one, see if I can't. Okay. This is my markup to show that I don't have very good handwriting either. This is the minority report for 1139. This is the essential caregiver. This is the nursing home bill. And the only change to this is you can see the markup of the original bill. The only change here is the request to add the power of attorney for healthcare in here. That was a request by the sponsor, and that was what I was directed to do by the folks who are on the minority report, that this is how, and we included it so that the power of attorney can either be chosen by the caregiver or they are designated by the resident if they are unable to choose for themselves. In other words, that's a person who is, for example, might have dementia. So that's the minority report. We don't have the fiscal note for that yet, but I do not expect that. So those are my amendments, and I do have something else to bring up if those are all good. Can we talk about another bill?
Sure.
Because I have a problem with LD 1204. This is Senator Baldacci's bill that was Representative Riley's bill a couple of years ago, related to parents of a child who who qualifies for in-home personal care services. And the bill was changed a little bit so that if the parent was unable to find somebody to, they already looked for direct care workers, and also they required a background check. So during the work session, so far so good, right? During the work session, right at the very end, just before you voted, there was a move to include CNAs. So this is drafted for PSSs. The problem is, in about 3 seconds after you all voted, I got an email from somebody that's like, you know, CNAs have to be overseen by RNs. I'm like, so I put it in the too hard basket for a while, drafted as many as I possibly could, but I don't know what to do. So I don't know how to fix it. I really don't. The other thing that you didn't talk about that I wasn't sure if I had missed was there was also the conversation about special circumstances. If you remember, there was some testimony that said that the bill was drafted only to talk about the eligibility of the child, not to talk about the eligibility of the parent. In other words, the parts about with the exception of a background check, the parts about whether the relative has, met all the licensing requirements or the training requirements or implementing the member's plan of care, whether they'd had to resign a job, that sort of thing. All of the things that are in the special duty nursing exception, which is the only other area right now that has that. So I'm not so worried about that. I just wanted to remind you that that wasn't included, but it's the CNA part that I'm stuck on. I don't know what to do. I got some help last night from one of the folks who runs these agencies, the person who's like, oh, that's a problem, right? And I'm like, no. So I don't know what to do. I asked about whether CNAs all were sort of PSSs in a previous life. In other words, could they sort of drop down to that PSS? And I guess that's not the case. They all haven't been PSSs. And I didn't know what the supervision really means. How often does that supervision have to take place? And he said that, it would normally be every couple of weeks. So I don't know what to do. I don't know how to fix it, because the way that this bill is drafted is because when we have relatives who take care of somebody who's receiving services, whether it be, Section 21 or whatever, if a parent or a family member qualifies to look after that person is an adult. And so they can advocate for themselves. This is different because it's a child. So that's why you have this separation where the parent is providing the services, but somebody else is taking the role of the employer, so that they, we all want to think that the parent is always going to be the advocate for their child. Like, we understand that, but the intent here was to have the parent be sort of the employee, but they can't be the employee of the child, because the child is a child. And so that's why they become, a personal care agency, and somebody else becomes the employer. So that's how it's drafted. And all of that is fine until you make the employee a CNA, because now you don't have the oversight part, because who is going to do that? So I don't know whether you want to take the CNA part out or how you might want to fix that, because I don't know how. And one of the ideas was, that you could have like an independent RN, but it's like, that isn't a thing. So it's not that it's impossible, it's just that it's not a thing. So I don't know how, CNAs are usually employed by agencies that also employ RNs. Mm-hmm. And this is different because it's about having an individual person being the caregiver and working for another sort of individual person who is chosen, agreed upon by the agency, by the department and the parent to take that role. And I don't know what to do.
Representative Perry, you had your hand up?
Yeah, I just want to know exactly what bill, because I wanted to look it up.
1204.
Oh,
Representative Craven?
Thank you, Mr. Chair. I think that was put in just to make sure that somebody had the skills to provide care for the child, but parents probably been doing it their whole life, so they're plenty skilled. So I would recommend just taking the CNA part out.
Okay, and that's fine with me, Representative, but that was the request of the constituent in Senator Davis's district, because she was the one who was in Colorado, where I guess they do that because they kind of waive all those requirements. But yes, we can absolutely take it out.
That wouldn't preclude her from I mean, she doesn't have to even admit that she's a CNA. If you know what, it wouldn't preclude her from doing the care herself.
Right. Representative Perry?
Yeah, my question is, it was the bill I thought it was. I just wanted to make sure on that part of it was care. I mean, caregivers can already do this if we don't.
Not and get paid.
Am I correct?
Not if they're going to get paid. This is about paying them.
This is about paying the caregivers.
Right. This is about getting a waiver from the federal government to allow this for a person to get paid as a caregiver, because, you know, these are people that have had to presumably, you know, give up a job, or they're unable to work because of the needs of their child while they're still a child. So that's why it matters. Otherwise, we wouldn't regulate it at all.
So we're really talking about paying the caregiver, not
right. And this is written so that the person who would be paid is doing personal care services, which is PSS level. And there was a request to include the CNAs, but when you do that, I mean, it's, you know, it's kind of funny when you think, you know, CNA is like a higher level than a PSS, but in order to be paid and hired as a CNA, you need to be working under an RN. Whereas in this case, you're providing personal care services, which is a lower level, but somebody else is the employer. And it has all the contingent effective date and all of that stuff that goes along with the waiver. That's not the issue. The issue is only how on earth do you include the CNAs? And I don't know how they do it in Colorado. I can't figure it out.
Well, I guess the other question I have is, you're going to get just paid what a PSS gets paid. What if you're an RN and you're taking care of your child?
There's actually already an ability to do that. That's the private duty nursing. Yeah, that's the model I think they're kind of working on. But that's the one circumstance in which this is allowed. It's the only current circumstance in Maine in which this is allowed. And it's very specific to being a nurse and having to give up a job and all the other sort of, you know, special circumstances that go along in the rule.
So the proposal is to leave out the specific language related to CNAs.
Or not draft it. It would be basically the current language plus an emergency preamble.
Right. Representative Meyer?
I would agree that's the way we need to go on this one.
Is the committee okay with that? There's a thumbs up. Okay, lots of thumbs up.
So that's what I will do. That will also have a fiscal note at some point. But if I'm just drafting an emergency preamble, there's nothing substantive for you to see other than the fiscal note when it comes back. I'm horrible at writing emergency preambles. Apparently, Erin is quite good at it. She tells me that none of hers come back from the revisor's office and being all scribbled all over, but mine are always scribbled all over. And I always just write a little note saying,
now, kids, come on. All right. I'm going to kick you out of the sandbox. All right. So is that the sum of the work we need to do today?
Yes. So can we just talk 1 minute about what we have to do next?
I'm going to promote a panelist a minute on the chance that I can embarrass him a little bit. So I've just moved Peter Merrill in. Peter will be leaving to pursue other opportunities. And I just wanted to thank him for helping me understand a bit more about housing and Maine housing than I did before, and for the years of work he's done to try and help Maine with affordable housing. So this is my opportunity to embarrass a man who's also somewhat related to me. So thank you for all that. And thank you for your help, Peter.
Well, thank you very much. I appreciate it. And you certainly caught me not expecting to be seen.
Well, this was an opportunity. I preface my remarks with an opportunity to embarrass you. So we can check that box off. All right.
Peter,
Well,
are you really leaving?
let's say I'm transitioning. I have not announced retirement at all, but at the beginning of the session, or last fall, I sat down with my boss and I said, the legislature is a 2-year process. The Congress is a 2-year process. I'm not entirely sure I can promise you 2 more years. And so we decided to do some succession planning, and we were able to do that. And we were particularly lucky that we were able to grab Eric Jorgensen. So we've been tag teaming, and that certainly makes it, I could get hit by a bus tomorrow and life would be fine. I wouldn't be worried about a thing as far as the transition goes. So, but I would, I guess, also take the opportunity to just tell you that over the years, working with the legislature is just a fascinating experience, and it's very fun to listen to Eric, who's been kind of cloistered in appropriations, so he didn't even know how regular committees work, much less what it's like on the lobby side, and how much work you put into things that are obviously not going to happen or go anywhere, but just to be careful. But the thing I think that I've enjoyed the most over the years is not only working with the members of the legislature, but particularly the members of the staff who are, as you know as well as I do, the key people in making everything happen and making sure it happens right. So I would just thank them and you for all your help.
Thanks for being here, Peter.
You owe me a beer, Ned.
I do. I know. Say hi to my cousin.
Thank you very much.
So thank you for indulging me on that. I saw him in the waiting room, and I knew he had plans. So, all right. So back to Anna and Aaron about additional stuff we need to do from here.
Okay, so before I forget, I want to announce that there may be a change to the LD 1001 minority report. I just want to let you know that I don't know what that is yet. This is where we began today. So I will let you know if that changes and what that language looks like, but I don't know yet at this point. And then the other thing I wanted to mention is that we obviously do still have some things that you don't have yet. So as we draft those things, I don't think we have a whole lot of options other than sending them by email, and the same for whatever fiscal notes we have. I believe there's a possibility that there isn't a session next Friday because there are a number of other what do you call them, confirmations. And so it's possible that if there are some that bounce, in other words, if I send you an amendment and somebody says, I don't like that, or I don't think that's right, there may be an opportunity on Friday to have those conversations, and the same for fiscal notes. But in the meantime, they're going to come by email, or they'll come to your seats, which is sort of the same thing. They'll come to your email, and if you have some questions, then just call us. But, I read out the list that I have, which was 9, it's now 8, because I'm just going to put an emergency preamble on that other bill. So that makes it 8 really, but you do have a number of fiscal notes. I don't know if Erin has more to add to that.
Just wanted to make a plug for FOA, and if somebody does have a problem with one of the amendments that gets sent out, just to reply to Anna or I, whoever sent the email, and not start a committee discussion. Thanks.
You don't want to see Grumpy Cat again.
I know, it might elevate Grumpy Cat.
Ooh, there's a threat. All right, Representative Perry, you had your hand up.
Yes, I believe I missed a vote on, I think it was 695?
1695. Are you ready to record that vote, Carrie?
Yes.
Okay, and I want to vote on not to pass.
Okay, thank you.
All set there. Okay, Senator Baldacci.
Thank you, Mr. Chairman. I think I missed a couple of votes because I've been going back and forth. Would you mind if I cast those now?
Sure, we voted on 1001 and 1695. So Carrie still got 1695 of that was unanimous so far, ought not to pass.
Okay, so ought not to pass.
And 1001 was ought not to pass. And I have 6 yay, 3 nay, and 4 absent.
Okay, ought not to pass.
Thank you.
Those are the only two we voted on today.
Okay. Thank you, Mr. Chairman.
And if I may, Senator Claxton,
Please.
while we're on the subject of 1001, Representative Griffin, I'm sorry, could you just confirm for me if you want to be on the minority report of ought to pass as amended?
Yes.
Okay, thank you.
Anything else to be considered? All right. Well, we touched about 50 bills this morning. And that represents a small portion of the total bills we've had to touch over the session. So again, lots of gratitude to Anna and Aaron for your abilities and your persistence. And hopefully you'll be able to catch up on some sleep one of these days. And so thank you for that. And thank you to Carrie for your role in getting things out the door as soon as they're blessed by the analysts. We've been fortunate to be able to work with you this session. So Representative Stover.
Thank you, Senator. I just wanted to say to everybody, even though we haven't sat together, I'm appreciative of all the work that everybody did. And I hope over the next couple of weeks when we're in the same area that maybe we could all join together, even in our committee room, just to say hello, because we haven't had that opportunity to see one another, except for in passing in the Civic Center. So It would be really nice to just join together for an occasion. Thank you.
Thank you, Representative Stover. Any other comments people want to make before we adjourn? I'd entertain a motion to convene in January at a date to be determined, but we're likely have work to be done between now and then.
So moved.
All those in favor of adjourning for the foreseeable